you again.
Apart from me.
I'm going to Mexico. I don't think I'm pregnant.
Okay.
But it's the paranoia, I think, due to the Zika and everything else. I want to make sure.
How much are you smoking?
1 to 2 a day. Cannabis, so I find when I don't, I end up taking more morphine.
Can we have a quick look and see?
Wow, yeah, that's terrible.
So what are her thoughts about you and the tablets?
Most of her family have died of cancer, and she'd do anything to keep you alive.
Just going to have a sharp scratch of medicine. Stay still. Good man. Good man.
How comes I'm bleeding, you're not?
Well,
I must be dying then.
You're not dying. That's too much paperwork.
I've got a swollen testicle, there's a bit of skin, and there's a bit of the end flapping off and that. And
Goodness.
Around a bit.
I think we need to take a look.
Hello, Farnham Surgery. Nikki speaking. How can I help? Dorothy Broom, please. Take your time, Dorothy. You're all right.
Once you get going, you're okay, are you? Good. It's just stopping and starting. Do you know, before we sit you down, would it be all right if we came across here and got you up on the couch? Because it's your hip you told me on the phone this morning, yeah?
Yeah.
So it started playing up when?
Saturday.
Are you all right to get up there? Oh, dear, don't do that. No jumping allowed.
Oh, OK. It hurts most of the time. But except when I'm lying down in bed, which is nice.
Then it's OK.
Can't stay there all day and all that, can I?
It's when you get up and start to try and get
That's right,
going.
yes. Yeah, getting out of bed in the middle of the night to go to the loo is absolute nightmare.
Right, OK. Relax back for me.
This one.
Have you had both hips done?
Yes.
I thought you had, yeah. Does it hurt when I press in there?
That does, yeah.
A bit tender there over the back.
Yeah.
OK, now I want you to bend the knee for me. And that's hurting in the same place, yeah?
Yeah, yeah.
And up. That's not bad. Yeah. Let's get you back up, OK? Let me help. There you go.
Ooh. Nothing. As soon as I got in, everyone's just been asking where you are. You do know, you know you're supposed to start at 9, right?
9:30.
Oh, OK, so your 9 o'clock is still already here. I think they forgot to change it on there then.
We don't know yet that there's a definite problem with it. It might just be a bit of inflammation in some of the muscles.
Yeah, and it might get better.
So, are you taking anything for it?
No.
Naproxen?
No, that's it, yes. Now, that's a good painkiller, but it addles your brain, something terrible.
Does it?
Yeah.
Right, made you a bit drowsy, yeah.
Oh, it makes you feel as if you're not in the world, you know?
Anything else?
I've also taken cocodamol.
How much cocodamol?
Oh, only once.
And is that 1 or 2?
As and when, if the pain gets any worse. I'm trying not to take these things on account of you sending me off down to have my liver tested. Yeah.
So, I think at the moment you need regular painkillers, yeah?
Yeah.
So you definitely need something twice a day. If you're going to carry on with the naproxen, Dorothy, we need to have you on something to protect the tummy.
Yeah, I don't like taking all these things.
No, but we're trying to get rid of this pain in your hip. Yeah?
I know, yeah. I know.
After a couple of weeks, there's no improvement, then we might want to get the hip x-rayed, although without you having done anything.
No, I didn't do anything. And I never fell over in my life till you told me about that, till that Balls Clinic woman. I never fell over once.
I know.
Right, OK.
Have you got everything?
Pardon?
You got everything?
Yeah, I didn't have any.
Oh, Dorothy.
Yeah.
Did you walk round?
Yeah.
Did you?
Yeah. I'm one of your neighbours, you see.
I know you're not far away.
Yeah. I know what's going on.
You take care, Dorothy. Bye-bye.
Good morning. I'm fine, thank you.
Which room am I in? It's round.
She's Charlotte's mum. Oh, are you? Yeah, she told me to look out for you.
Did she?
She said she's trouble. That's what she told me. So I'm only telling you the truth.
No, she's not lying. She's not lying.
You're in room 3.
Cheers, thank you.
Okay, thank you.
That's nice to meet you.
Take a seat. How can I help?
Since Saturday, yeah.
She's got very strong lower abdominal pains. Her periods are all over the place. She's got a temperature and she can't sleep, although she's tired. And she's saying that the symptoms are very similar to an ovarian cyst she had a couple of years, 3 years, 4 years ago.
And your periods, what normally happens to your periods?
Normally it was like every 28 days.
Okay, a personal question, are you sexually active?
Not really.
Not really. Okay, when,
That's my fault.
the reason I'm asking is
I'm not
it pain on
pregnant.
intercourse? No, but pain on intercourse.
Oh, no, we didn't have sex for
No.
a long time.
Okay, so there's no pregnancy,
No.
no chance of this. Okay. Okay, I need to just have a feel of your tummy. Okay. But if you lay on your back and just relax as best you can, is the pain getting worse or staying the
it's
same?
like,
or?
it's constant pain, but
Yeah.
sometimes it's like getting very sharp.
Are you okay getting up onto the couch?
I'm okay.
Okay. Just relax. Can you point to where it's hurting?
Just
Here.
this side.
And you're not getting any pain on passing of water at all?
No.
Nothing at all. It's there, isn't it?
Yeah.
Okay. Just relax, okay? You can just lay there for a bit.
I'm okay.
Morning. Thank you for sitting me.
How can I help today, James?
Doctor, I'm not getting enough sleep.
Okay.
I'm averaging at most 4 hours every day. The bigger problem with that is when I try to go to sleep, I'm sometimes lying there for 2, 3, 4 hours.
Okay.
What I do is I lay there and I count up to thousands sometimes. Hoping if I start making mistakes, getting numbers wrong, then I know I'm going to fall asleep. But it doesn't happen no more.
Okay. Anything in particular that's changed over the past?
Well, the only thing that's changed is I gave up drinking alcohol a long, long time ago.
Okay.
I was in rehab last year.
And you've stopped completely since then?
Virtually stopped completely.
Fantastic. That is amazing. That's one of the best things that you could have done. So do you feel down particularly? Or?
Very, very rarely do I feel down.
Have you had any thoughts about hurting yourself or harming yourself or anything?
No, nothing like that.
So your mood you mentioned is not particularly down?
No. Since I've come out of rehab last year, I feel like a new man almost.
Good, good.
But it's just this lack of sleep.
Okay.
I think you're not unwell. You're in a bit of pain, but you're not systemically unwell, that I can tell. Urine dipstick. The urine dipstick was normal, but your history suggested that it would be. I don't think we think it's a water infection. My guess is it is a cyst. I think we need to do a scan to see whether it is. And so I think we can get away with giving you some pain relief and some anti-inflammatory tablets to try to calm the pain down.
Yeah.
If the pain becomes more intense, I would go to casualty. If you rupture a cyst, it may require a further treatment, okay? And I'd want you to be seen. What we'll also do, okay, is we'll do some blood tests as well, just routine blood tests. We'll check your hormone profile. We'll just give you a bit of an MOT. Is that okay?
Yeah.
Yeah? And I will give you some painkillers to take. There you go, okay?
Thank you very
Take it
much.
easy.
That's lovely. Thanks for your time.
No problem. Thank you very much.
Cheers.
Bye-bye.
Bye now.
Thomas, there's lots of things that we can do, okay? I'm going to print you off a leaflet, which is a sleep hygiene leaflet, and it tells you everything that you should be doing. But in addition to that, I can give you a small amount of medication that will just help you get to sleep. Okay?
Can I ask you one more question? This is just a mild one.
Usually in a 10-minute consultation, we can only deal with one thing.
But I can look up online what the problem might be.
It's better that you make another appointment to discuss it with us.
Okay.
Because what we don't want to do is we don't want to miss anything. That's the thing.
Yeah,
We want to make sure that we deal with all of the problems effectively.
Okay.
So it's really important that we get these things sorted. Now, for the sleep, the medication I'm going to give you, Thomas, I'm only going to give you a very small amount.
Okay.
So you take one, maybe tonight, tomorrow night, and then stop, see how you go. And then if you're back in the routine, fantastic. If you feel that you're better, not quite there, then you've always got that medication to fall back on the last 5 minutes.
Just to get even just 5 hours, that would be wonderful.
There we are, Thomas.
Okay, thank
All
you
right,
much.
no trouble. No
Okay,
worries.
doctor, have a nice day then.
You too, buddy.
Thank you much.
No worries, Thomas. Bye-bye now.
Bye-bye.
Can I help? If anyone has an appointment, you can check in on the self-check-in. Hiya.
I want to make an appointment to see my doctor.
Hello, come in.
All right.
Hi there.
All right.
Okay, just take a seat, lovey. So you've come for your asthma review, Amanda. How often are you using this in a week?
I've been using it quite a lot.
Okay. Show me how you use it, please.
Is there any in it?
It should be. Stop.
Feel running out as well.
1, 2, 3, 4, 5.
It's empty.
6. Shut up. You're joking?
Yeah, it's
You
empty.
give me the empty
I've
one.
got one.
Have you? You haven't got one.
Not the blue one.
Okay, so this is empty. So what we'll do is I'm going to make sure you've got plenty on repeat.
I feel guilty now because that's my fault because I should have checked.
We're okay because she didn't have an asthma attack, so don't feel guilty about it, okay? Because we've resolved it, all right? Now, do you have any asthma symptoms during the daytime? Cough, wheeze, tight chest.
It's mainly wheezing.
Does your asthma stop you from doing anything?
No.
Great. So basically, you take your pink one as prescribed,
Okay.
then you're using your blue one when you've got symptoms.
Could you...
Now,
Sorry. Could you write that down just in case
yep,
I forget or
Yep.
my missus forgets?
yep, that's fine. I was going to give you a little plan.
Yeah, I was going to say.
So, if I don't feel better, give me 2 puffs of that's the blue one,
Okay.
and then you can have a maximum of 10 puffs.
Okay.
So that means that you're struggling to breathe, so you take your blue one because that's going to open your airways quickly, and you have a maximum, as it says here, 10 puffs. If you're needing 10 puffs, we need to see you.
Okay.
Yeah, because you might have a chest infection, we need to have a listen to your chest. Or if it's really bad still, you need to go to the hospital. Okay?
Yeah.
I'll give that to you.
Thank you.
Is that okay?
Yeah.
So that will sort of jog your memory a bit. Do you want your flu vaccine, darling?
Yes, it's
Great.
both of us.
Are you right or left-handed, sweetheart?
Oh, my God, no, not that.
I'm having
needle.
this one, but I can't do
Okay, that's fine. He's turned away.
I don't like needles.
Done.
it. See? Quite
Well, I don't
easy.
care, and I start sweating as soon as the needle goes in me, I'm
Easy. It
gone.
didn't even hurt.
What, am I giving you your flu vaccination?
Well, I ain't got a prayer, have I?
Because you need to help her. You can't be sick.
Swap the seat, because I'm telling you what, I'm sweating up and I ain't even had it done yet. I'm right-handed, you can't hold my hand.
Yes.
Should we do it here?
No.
No one, Mum, we'll be fine.
Sit here. Sit here. Pull your. Tell me
Sweating
which
up
arm
already.
you want. Which arm do you want it in, Gary? Here.
I'm right-handed.
Okay, let's do it in that one. Okay.
I'm in the wrong seat.
So
No, you're fine.
Scratch.
Right, just going to have a sharp scratch of medicine.
Stay still.
Good man. Good man. Hold that there for me. Thank you very much.
How comes I'm bleeding, you or not?
Well,
I must be
there.
dying then.
You're not dying. That's too much paperwork. I am going to go and get your wife's prescription signed. If you both take a seat in the waiting room, and I'll be back in a minute.
God.
Okay. Oh, I need somebody.
I'll watch it.
Thank you.
There's that
I'll
thing
be there
behind
in
me.
just a minute, all
Cheers,
right?
a bit.
Okay.
Oh, that's sore now. Ow! Where are you going? I'm not walking back out. Didn't tense up, did I? Yeah, I hate needles on. That bloody hurt.
Nice to see you all.
And you?
I'm Dr. Tawana. How can I help today?
I've spoken to you a couple of times on the
Okay.
telephone about Annabelle's condition.
Okay.
She's broken her arm
Oh,
3
okay.
times.
Yes. Tell me
About
what's been
her,
happening.
well, the physio that she had after her last break said
Mm.
she had hypermobility.
Okay.
And we thought that had gone on the records, but
Yes.
it obviously hasn't. So
Okay.
we thought we'd make an appointment, come
Yes.
and see you,
Yeah.
to get her checked over and to confirm that's definitely
indeed
what
the
she's
case.
got.
Well, what we would need to do, has she ever seen a children's specialist?
No.
No. That's what we would
Oliver,
be
no,
considering doing, just because a diagnosis of hypermobility tends to come from our specialist.
Yeah.
Hypermobility syndrome is a condition where you can see a bit more flexibility of joints. In addition to the increased flexibility, other signs and symptoms may include pain of their muscles and joints, tiredness, although there are some less common symptoms which can include things such as bruising easily, headaches, abdominal symptoms as well. Can I just check, with these fractures that you unfortunately had, were they pretty much innocuous kind of injuries, or actually with some force that these fractures occurred with?
The first one she had was just falling over a bouncing toy we had, and she just fell on the floor.
And then
And
broke the bone there?
That was the worst one, because she
Yeah.
had the op for that one.
It's okay.
And pins.
Yeah.
And the second one, she fell from a climbing frame, which gave her a green stick fracture on this arm, I believe. And then
she went up the slide there and fell.
she fell off the slide and did this one again.
Right. I think what we need to do, quite simply, is get you seen the amount of fractures that you've sustained. I think it's a reasonable diagnosis, but I think just for formality, to get it properly confirmed.
Yeah.
The vast majority of patients that are affected will actually get better and will grow out of their symptoms and improve over time. So leave that with me.
Brilliant.
I will send that referral off in the next day or so, and they will contact you directly with a letter, I suspect, at the home address, and we'll go from there.
Brilliant.
Do you want to see? Yeah. Pop this in your ears. There you go. And then what you do is I'll get you to hold it just there, around about there. Does it sound good? Lovely. Okay. Take care, guys.
Come on then.
Bye.
Bye.
Bloody hurts. Please help. Pain.
Dr. Tree, is this one?
Yeah. Come in. Hello, Doc.
Hello.
It's me next.
Hello.
Saviour. Saviour coming out. Got a little problem.
Okay, let me bring up your... So you're managed at Mount Vernon, aren't you? That's
Yeah,
the main,
well,
main
sort of,
site.
yeah.
When are you due... So you had
Oh,
some...
I've got to go there today.
Okay.
Radiotherapy.
How are you?
Oh, apart from I'm just gone under 10.5 stone, not too bad.
So you've gone down to 10.5 stone?
No, just under 10.5.
Okay.
These are the tablets I'm supposed to be taking.
Yeah.
I don't like any of them. I tried to tell my wife to crunch them up, put them in any old drink, give it to me.
Mm.
But she don't like doing that. She's an honest woman.
What do you not like about taking tablets?
Getting them in without me being sick.
Okay. So you feel quite often the tablets sit in your throat?
Yeah.
Okay. Because there are sometimes other reasons why people stop taking tablets, because they're just fed up of life.
Oh, God, no, I'm not fed up with life.
Right. So that's what I was trying to gather from
Jesus
talking
Christ,
to you.
no. I've got £20 each way on Slough Town winning the league.
Right.
That's £665. Who wants to die when I get that?
Okay. So what would you do if you won that money?
Give it a wife. Something stupid.
So she's your major rock. So what are her thoughts about you and the tablets?
Her thoughts are that most of her family have died of cancer. And she'd do anything to keep you alive.
How can I help you today?
So I'm late. I don't think I'm pregnant, but purely for the fact that I'm going to Mexico in 2.5 weeks.
Okay.
Due to the Zika and everything else, I want to make sure that...
Did you do a pregnancy test at home?
I've done that. It came back negative.
And usually your periods are regular?
See, yeah, usually yes. But I think I may have messed them up a little bit. Initially, we had booked Mexico to go and try for a baby. Then the Zika thing kicked off.
Okay. So Zika virus is carried by a particular type of mosquito. In 2015, there was an outbreak of Zika virus infection. And since then, it has been spreading in many areas of the world, particularly South America, Central America, and many of the Caribbean islands. There are other methods of transmission of Zika virus through blood transfusion, sexual contact with a person infected, or pregnant women can pass on the virus to the babies through the placenta. But you have been using condoms?
Yeah, we've been using condoms.
So no unprotected sex?
In my heart of hearts, I know that nothing's happened, but it's the paranoia, I think, because I'm never late.
Yeah.
I have bought a test.
Okay, if you have a test, you could repeat it.
Okay.
Yeah?
Yeah.
So I would prefer you do the blood test, because blood test is more sensitive. It will just tell us the hormone levels.
Okay.
If it's less than 1, then we know you're definitely not pregnant.
Okay.
Why don't we do that?
Okay.
Yeah?
Yeah.
The main concern of a Zika virus was the adverse effect it can have on babies. Zika virus can lead to birth defects, especially microcephaly, which is less developed brain and a small head. And there have been reports of premature deaths.
The other question I had, when we come back, obviously then onwards, like that's when we do want to try. But I've read on the NHS website that when we come back, we're still not allowed to have unprotected sex for at least 8 weeks.
Because there's an incubation period there, isn't it? Yeah. As Zika virus can lie dormant, it's really important that you take precautionary measures. Men who are traveling to the countries infected with the virus should ensure that they use condoms during travel and at least for 8 weeks after they return. Women of childbearing age should also avoid getting pregnant for at least 8 weeks after they or their partner have traveled to a country infected with the Zika virus.
What are the symptoms?
I mean, it's more generalized symptoms, fever, aches and pains, anything that is, you feel unwell, we say come and see us, especially if you have traveled.
All right, so then you would just test us if we are ill.
If we have any symptoms,
Okay.
yeah? Okay.
All right, that's fine then.
All right.
Okay,
Okay, take care. Bye-bye.
She really wants you to be taking the tablets.
Well, when I take them, I'm sick. Because I see the tablets.
Yeah.
And it's just my natural reaction. I've got a little feeling just there.
Yeah. Because remember, where the cancer is possibly one of the reasons why you are having difficulty.
Yeah, of course it is.
What you've got is on the left tonsil and base of the tongue, there was a tumour.
Yeah.
And so they're trying to shrink it with radiation.
Yeah, doing it.
So how long has it been since you took your tablets?
Oh, if I told you, you'd have a heart attack.
So I'm putting them out here so that we can sort of see what you're taking. They are actually more symptom-type things. So this is meant to stop nausea and sickness. What happens when you take them?
You get sick.
OK. You could manage without them, that's fine. If you don't want to take that, that's OK.
Right, so we put them in there.
We put them in there.
That's a bin.
This is if you have loose stools, diarrhoea.
Oh, we put them
This is
in there.
Imodium, OK? This is a steroid medication.
What are they for?
What these do sometimes is just help sort of improve your appetite, for example. Are you eating OK? Do you still have an appetite?
No.
So you're not eating well?
No, that's why I'm losing weight.
Have you seen...
A dietitian? Yeah.
No. So I need to organise that for you.
Yeah, but I can organise that at Mount Vernon. So you can get rid of them. So that's it, it's job done.
So if you want to manage without that and then start off with the dietitian...
How about ice creams?
Fine.
So if I go and get 20 ice creams to stick them down my throat, that's fine.
Obviously, it'll be better to have a varied diet. You'll feel
Right.
sick of ice creams very quickly.
I won't. What about these bottles of...
The drinks.
The drinks.
Something like
Yeah.
Complan.
Yeah?
This would be a start, but I really recommend you do see a dietitian. Okay?
Oh, yeah, I'll see one today. I'll go down there early.
Okay.
I'll look at it this way. If I don't eat, I'll die. And that's an encouragement for me.
Okay. Good. Is that all right? Do you have any
Fine.
questions?
No, not at all.
Good. Do you feel okay with the, when we were talking, you were quite upset initially, but do you feel you can tackle this now?
Yeah, of course I can.
Okay.
Simple.
Good.
Thank you very much,
Let
Tom.
me know if there's any problems with Mount Vernon, okay?
Nah, they won't be.
Take care.
Don't worry about me.
I'm sure many people do.
Come in. So 5:10, Dr. Lee, room 2. You're very welcome. All the best. Bye.
A lady was given this for her daughter, but the pharmacist told her no, it's got to be 2 grams.
She is 3.
My granddaughter, she's 4.
Granddaughter.
Yes.
As they say, time has been untruthful.
Oh, yeah. Can we come? Oh dear, they're all going to experience this, are they? Oh dear. Okay. Come in, everybody. Oh my goodness, how many more? Is that it?
No, the other 2 at home.
Right. So you want a jab, is that right?
Yeah, the left hand's coming back, but the right hand's starting to hurt as well again.
I need to get you to sign a consent form, is that okay?
Yeah.
I'm 20 stone.
She's not 20 stone.
Okay, so basically I'm saying that you're having a steroid injection to your left carpal tunnel with the idea to reduce pain and symptoms. There's a small possibility of infection, bleeding, pain and recurrence. And if you're okay with that,
Yeah.
you just sign that. Fantastic.
I've had enough.
I'll get this ready.
On my birthday, can I have pasta, popcorn chicken,
And pasta?
pizza?
Your birthday isn't till next August.
Can I have pasta?
Okay, so that has to turn over this way.
Oh, it's the other side, isn't it? Yeah, they've just introduced this healthy eating at school. They're not allowed crisps, they're not allowed chocolate bars. And I'm like, well, that rules out him eating anything.
Oh dear.
Plain slice of bread
A
and
little
a
quick now,
carrot.
sorry.
Oh.
That
bit more.
Oh, am I good to go? Don't cry. Don't do that.
Well done.
You try having it pipe and tell me it doesn't hurt.
You've done really well. She's done really well.
It stings really, really bad.
And it looks disgusting.
Let's see how that goes.
Okay.
I'd use a little bit of ibuprofen just at the moment to see
Yeah.
if the anti-inflam helps. You may find that when the weather cools down a little bit, it may not be as bad either because there'll be some fluid retention.
Yeah. Come on then, just gonna get you dinner. Thank you.
Right, everybody. See you later.
There we go. Oh, it's never for the receptionist. I'm really glad it is. There we go. He loves you.
Oh, and I bet there's 28 there as well. Thank you.
Hello, Dr. Nanda. How are you?
Not bad, how are you?
Yeah, fair to middling.
Good. Before I forget, you're due for the flu jab.
Yeah.
Shall we do that?
Yes, please.
Okay, let's do that. Especially when you're, from what I can see, relatively sort of well devoid of any infection or anything.
Well, I've just got over a chest infection.
That's okay.
So
you're not
3
really
weeks ago, I was given antibiotics.
I saw the notes, yeah.
I've known Kevin Brown for the last 2 years. He's got multiple medical conditions, some of which include problems with the heart, problems with the lung, emphysema, which is scarring of the lungs.
Still smoking, are you? Or?
Occasionally.
Occasionally.
It's not cigarettes, though.
Sharp scratch? Sorry.
That's okay.
Hold on. How much are you smoking?
1 to 2 a day. Cannabis, though, helps with the pain. And I find when I don't, I end up taking more morphine.
Cannabis in its raw form is injurious to both physical and mental health. However, I do think there's a lot of potential for the ingredients, if it's well formulated in the right appropriate amounts, to be used for some medical conditions like glaucoma and relief of nausea in chemotherapy patients, and also multiple sclerosis.
So this might sound a bit repetitive for you.
I know.
But smoking
I understand.
in the setting of emphysema is going to worsen the situation and also increases your risk of frequency of infections.
Yeah.
So let's have a quick listen to your chest, especially after the infection that you've been. Thank you.
I do feel there is more research that is needed to unlock the potential of cannabis. However, the early results are promising.
So you've done the flu jab today, and the chest is absolutely clear for a change, and I'm quite pleased.
So am I, actually. I can breathe, you know.
That's good. I think you've done pretty well.
I won't go to hospital. I'm a terrible patient.
Yeah, if you look at the last 4 to 6 months, I've not seen major admissions there.
No.
So that's a success story.
I won't go.
Yeah.
I'll just suffer at home. If I go to hospital, I'm open to infection.
That's right.
You know, the last time I was on a respiratory ward, I ended up with pneumonia.
That's right. Hospital-acquired infections, as well as other types of issues.
And I know that pneumonia with my present condition is not going to be friendly.
That's right.
So thank you.
Let's try keeping in the community. And
Well, I'd rather stay in the community. You know,
that's right.
I'm grateful for the way I'm being treated here. It is a marked improvement from my last surgery.
I'm pleased. Okay, all the best. Yeah.
Thank you.
Take it easy.
Thank you.
How are you getting on? Skin improving a bit? Or not?
Nah, it's getting worse. And my arthritis is getting quite bad as well.
Okay.
My joints.
What I'm going to do is I'm going to try and get the girls who organise what we call patient services to try and see if they can push some of these appointments.
Yeah, no, that's fine,
because I think, you know, it's obviously, you know, affecting you really badly at the moment, and we need to try and push them to try and get you in as soon as we can. So I think that's what we'll try and do there. Okay.
Ryan has a very severe case of psoriasis, probably the worst that I've personally ever seen. Linked with that, he also has a type of arthritis which is related to the psoriasis. Both of these conditions are caused by an autoimmune problem, so his own immune system is reacting against his skin in particular for the psoriasis and against the joints for his arthritis as well.
Which joints at the moment are being affected?
It's my knees, really.
Yeah?
Yeah.
Are they swelling a lot?
No, they're not inflamed or nothing. It's just really tight.
So it's just tight. Okay, can we have a quick look and see?
Yeah, my psoriasis on my leg's quite bad, though.
That's all right. Deary me, it's a shocking time, aren't it? Wow. Wow.
Yeah.
That's terrible. Has it improved at all since you've been on the methotrexate?
No.
Because you were off it for a little while at one stage, were you, or not? Yeah. How long were you off it for?
Not that long.
No?
No. But it's really bad.
Yeah, I think you've proven your point to me. Are you using anything else at the moment just to moisturise?
When I get in a bath, I use my Cetrabend thing I've got.
Yeah. Okay, use that as a soap substitute.
Yeah.
Is that right? Okay. Are you getting out in the sun and trying to blast it like that?
Best thing I ever had treatment-wise was the sunbeds.
Yeah.
Cleared up straight away.
We've known for some time that people with psoriasis do better during the summer months when they have natural exposure to the sun. People who use sunbeds will often find that their psoriasis is helped as well, although there would be very few occasions when I would actively tell a patient to go and use a sunbed. In Ryan's case, I think that's a reasonable thing to do short term, particularly if he comes in to be seen and examined to make sure that there are no other issues associated with the sunbed use.
So that's just the Cetrabend, okay, which, you know, is a bigger amount, so it's about a litre of it. Okay, because you just need to try and moisturise, I don't know, because your whole skin's flaking off. Do you need anything more from me?
Yes, I do. A sick note, if that's possible.
Yeah, I'm happy to do that. Okay, mate, that'll keep you going on that. Okay.
Yeah, okay.
I'll go and speak to the girls now and see what they can do.
Okay, that's fine.
No
Don't we
promises,
sort
but
that
I mean,
out,
we've got
or-
to. They'll get back to you.
Yeah,
about
don't
that,
we sort that out, or?
Oh, don't worry about
Yeah.
that. We'll sort it out.
Sorry about that.
Okay, mate. I'll see you later. Yeah.
See you later.
Bye bye.
Just to let you know, there's a guy with a lorry with the vehicles blocking people coming in and going out.
I don't know who
You're
is
going to
that
get a lot
is.
of people coming in saying, I can't get into my appointments and blah, blah, blah. I mean, I come in and said, I can't park, mate. I said, you're going to have to get out of the way. But anyway, I've got an appointment at 3:20.
Hi, come on in. Thanks for waiting. I'm Dr. Tawana. How can I help, Patrick?
I've got a swollen testicle.
Yes.
I've been off work for 5 weeks, and now where the tube comes out the testicle, there's a bit of skin and there's a bit of the end flapping off and that. And
Goodness. I think we need to take a look, just from the description you've given me. And this has been rumbling for some time, you mentioned.
I've been up the hospital, I've had an ultrasound and everything like that.
I'll have a look to see if they've come back to us. All right, let's have a look.
You just feel around it, yes, there's a lump, little bit of a skin, and then the end of it's coming off.
You'd be pleased to know that that's pretty normal anatomy, actually.
Is it?
Yeah, that's all right. But certainly, I would agree.
I've still got the swelling.
You've got swelling. Is it just this side or the other side?
The other side's all right. That's normal.
What about pain?
Pain I'm getting is up here.
Okay. I'll let you pop your clothes back on. We need to work out what we do from here, don't we?
Yeah.
The ultrasound result, it doesn't seem to be coming up in the record.
They said about 6 weeks for it to get better. It's been over 6 weeks and it hasn't even started getting better. I've got a daughter to feed and everything like that. I've got bills running up everywhere and that. I've got to try and get back to work as soon as I can, you know what I mean?
I hear what you're saying. However, it doesn't look like you're in a position to be working. We think this is a long-term infection within the testis itself. So we must press ahead with high-dose antibiotics. So I'm going to give you that today. Now, the hospital will call you to organise your ultrasound scan. I'm going to request it as an urgent one.
Yeah. It starts getting worrying. I'm nearly bloody 50, you know what I mean?
That's middle-aged. That's not that old.
Half my friends are dead, mate. Most of them didn't make it past 40.
Okay. Why is that?
Oh, just all sorts of different things, you know what I mean?
That's your sick note there, Patrick, OK? Another 4 weeks' worth of antibiotics, all right? And we'll go from there.
OK, thank you.
All right, Patrick.
Thank you.
Take care.
Oh, God. I want to get back to work.
I bet you do. Take care.
Hello, how are you, Mum? Nice to see you. This is Hafsa.
Hafsa, yeah.
Hello, Hafsa. And who's this? Older sister?
Khadija, yeah.
Hello, how are you? Just take a seat. So how can I help you today?
She's been sick for a week now. She had a fever, especially last 3 days. She was fine like this, but she's gonna cry like she has some pain in the stomach or something.
All right, okay.
So, yeah.
Just now and again?
Now and again.
Now and again, okay. Right, good. She seems to be pretty full of life. Do you want to get onto my computer? Maybe you've got some medical talent here that we should know about. So just hold your head. Could you take your temperature, darling? Yeah, we are. Well, she's done quite well. So I just want you to hold her. Yeah, just one arm around her arms and one arm around her head. That's right. So let's just look into your ear and see what we can see. No kicking, Hafsa, please. Now, right round the other side. No, don't kick the doctor. You can kick your members of your family, but not me. That's right. Because we're just looking in and seeing what your ear is like. That's very good. You're a very friendly girl, Hafsa, I'd have to say. Now we listen to your heart, just to see how fast it is. Oh, yes, good. That's fine. She has, as you can hear when she breathes in, she's making a noise like...
Yeah, she does that.
And so that's because she's got an infection in her airways. This is a fairly mild infection, but it's going to give her a temperature. It's going to give her some abdominal pain and probably pain in her throat and in her trachea because it's inflamed. Not badly. Give her Calpol when she's in pain. I think she'll settle down fine. I think I wouldn't be worried about her. Yeah, yeah.
That's fine.
Good.
Thank you.
Bye-bye. I'm going to shake hands. Bye-bye. Bye-bye. Nice to see you. Yeah.
For some reason, you've missed your appointment. I don't know why.
Hello.
Hi, Dr. Lee. I've had a lady waiting at reception for you. Her appointment was booked with you for 4:10. Can you still see her?
Yeah.
Okay, thank you very much. Thank you, bye. Okay, if you'd like to take a seat in the waiting room, he will see you, okay? Hi, can I help? Hi.
Oh, look at that sun coming out.
No, it's lovely, isn't it?
It's supposed to be all right, isn't it, now, the rest of the week?
It's supposed to be, isn't it? Yeah.
Hello.
Hello, Slater.
Wrong end.
Come on this way. Well then, come on in. Come and have a seat. Hi.
I have some boils.
Right, okay.
Troubling me for some weeks now. I've tried putting magnesium sulfate on them to bring them some
Okay.
surface, but nothing's really
How
helped.
long have you had those for?
They've been going on and off now for a couple of years.
Have they?
Yeah, I had a 7-headed one, 3.5, 4 years ago,
Yeah.
on the bottom. That was very sore.
Yeah.
So that ended up having to be lanced. But I just seem to keep getting them. It's small when I shave.
Okay.
And it's not sore when I shave, it's normal, but...
But then you get boils
Yes,
afterwards.
yeah,
Sounds
yeah.
like you've got an infection there.
Hmm.
Should we have a look at it?
No,
Is it?
that's
Is
fine.
it?
That's
is
fine. It's
Yeah.
Yeah.
But you're all right if we...
Yeah, no, it's fine. Okay.
Can I come in?
Yes. Sorry.
All right, gosh.
They're going all the way down and then
But they're always just on the outside. They're not actually inside your bits.
They've been going down that way, yes. And I have some. I've had a few on my bottom as well. Oh, but they're so painful.
Yeah, I can see that they are. That's fine. Do get yourself dressed up and come on out. Okay, so those infections, those are little boils, as you say.
They are boils, aren't they?
Yeah, and
Okay.
they're essentially what's happened is when you shave,
Yep.
the
Hair follicle goes down instead of up.
and you get a little bit of infection around the base of the hair follicle.
Why
And
do they not want to come out?
Well, it's because of the shaving that sometimes then you get a tiny bit of skin growth over it, and it just means that it can trap some of the bugs in the hair follicle, and so it happens more commonly when you shave.
Right.
What we need to do is to try and reduce the amount of bacteria down there.
Right. What causes bacteria down there?
Well, it's actually we're all covered in bacteria all over our skin,
Right.
everywhere. Some wash just to help reduce the bacteria there.
Dermal when I wash.
Well, I'm going to try something that's a little different from that, just to see whether that helps settle it down. The other thing to do is just think about not shaving there, because obviously that will reduce the chance that you get the infection there.
There is
But
that point.
And if you're getting other infections, or you're getting this as an ongoing thing,
Yeah.
should we be doing any other tests? It's not unreasonable to check your blood test, as I say, and then we'll see what's happened when we've got the tests. You don't get any under your armpits or anywhere else?
No, I use a different type of razor. I use Bic for there and electric for there.
OK. Blood test you can book in as well, and then I'll see you with the result. All right?
Yeah.
All right. Cheers then.
Thanks, Dr. Pelly.
Bye-bye.
Bye, darling.
3 trips for older people.
Where are we going?
I don't know. I'm just part of the Bristol Aging Better project. offering older people the chance to benefit from day trips.
What are you looking at that for, Jackie?
Well, because I'm an older person, yeah. We're trying to work out where we're going.
Come in, I'm Dr. Gosh. Do you want to sit down?
Thanks. I'm having problems sleeping. I got this thing where when I get up in the morning, as soon as I wake up, I feel so sick. And I got to get out of the bed because I think something bad's going to happen if I stay there.
Right.
And this has been happening for quite a while.
Okay.
So I've been treated for depression.
Yeah, I saw that, yeah.
But now I'm not even going to bed, I'm just sleeping in the chair.
Oh dear. So what exactly happens when you try and go to bed? Do you get to sleep to start with?
No, as soon as my bum hits the bed,
right,
I feel sick.
But what are you sort of worried about? What do you feel like?
I just think if I stay there and try and go back to sleep, I think something terrible's going to happen. I'm the eldest of 11 children.
All right.
But I've had 3 siblings much younger than me die in the last 3 years.
Right.
And I'm a widow. I've been a widow now 26 years. And it gets harder.
I'm sure it does.
People say, oh, time's a great healer. It's not.
Still very lonely, isn't it, for you?
I've wanted to die for the last 26 years.
Have you?
Yeah. I would not do something to promote my own death because I would not want my children to go through what I went through.
Yeah, sure.
That is the only thing that stops me.
Sure.
So
sure.
Each day I wake up, I think, oh, Jesus Christ, another day. You're here whether you want to be here or not.
Yeah, sure.
Must be a reason for it.
Well, there must be a reason for it, mustn't there?
Yeah. Just bug a lot of people on the way.
What do you think would help with all of this? I see you've tried some antidepressants in the past, haven't you?
I did, and oh God, they made me so bad.
You didn't really get on with them at all, did you? I mean, it sounds to me, there are a lot of groups that can help people who've been feeling down or struggling a bit.
Yeah.
And if you're the sort of person, particularly who is quite sociable by nature, you might really find that helpful. Would you like to give that a go?
I don't think so.
You wouldn't?
I'm not ready for the lunch with the old people. No.
The other thing is, have you met Heather, who's one of the receptionists here?
She got me, and I was going to do some voluntary work.
Yeah. Can I ask Heather to give you a ring again and see what else she can do? Because I think it's more. I think it's something you need to do, isn't it? Because I think it's more the social side of things, really.
The falling asleep. I wonder, could I have a blood test to see that I'm not anemic? I've always had it.
Oh, no, you did? You had one in March?
Yeah. It would show up if I was...
It was slightly borderline. It was just about all right. Let's check again and make sure you don't need any iron tablets.
Yeah, that's what I'm thinking, because
occasionally
over the years I have had to go on.
Yeah, and that can give you problems sleeping, definitely.
Yeah, exactly.
Okay, so book in for that, and I'll ask Heather to have a chat with you.
Okay.
Okay.
Oh, sorry you had to get me on...
That's all right.
The sun was shining over the nursery courtyard.
What's a courtyard? A field.
What's a courtyard?
Is it a field?
Courtyard.
Is it like a field?
It's in a playground, no?
Yeah, it's like big concrete.
Okay.
Yeah.
You're a new patient here?
Yes. Been overseas.
Right. And where have you been?
All over Africa, and the last 3 years was Sri Lanka.
Right. Very nice.
So moving around.
What were you doing?
I'm a minerals person, so I'm scratching around looking for gold and diamonds normally.
Right.
Haven't found enough yet because I'm still working. So.
Yeah. And you're not from the UK originally?
No, I am. I'm fully English, but
right.
not many gold deposits around Bristol or diamonds or a bit of coal in South Wales. Used to be some tin in Cornwall.
Okay. So what have you come for today?
The main one I actually want to come back is I've had a lot of sun.
Yeah.
And my brother had very bad melanoma, stage 4. Very lucky to still be around after 6-7 years.
Right.
And so I've had lots of things burnt off me, taken off me.
Yep.
I now have this thing on my head, and of course, coming to a doctor, it's the smallest it's been in 7 months.
Right.
It looks a bit weird. It comes and goes. It bleeds a bit.
Right.
It gets bigger, smaller. So I basically wanted someone to look at that.
Okay. All right. So I'm just going to look at it with a bit of light and some magnification, OK? So it's a raised lump with a little dip in the middle. It is a bit sort of pearly. So there is a small possibility that that is not a malignant melanoma, but a different sort of skin cancer.
And sometimes if I just scratch it the tiniest bit, it'll bleed and run down a fair bit. And
Yeah.
I believe that's not necessarily...
So it's 6 millimetres. I think it'd be reasonable to go and see somebody about that. There's an urgent referral where you'll get seen within 2 weeks.
I'm actually going away right now
Yeah.
for 13 days.
OK, right. So
I would
they'll
like to have
see
done it
you-
urgently, you know, but...
Yeah. OK, well, hopefully they'll just see you...
After 2 weeks.
After that, yeah. Have you actually had skin cancers removed?
I've had, I'm never quite sure, carcinomas, basal
Basal cell carcinoma.
Basal cell carcinoma.
Okay.
Does that classify as a skin cancer?
Yeah.
It is, isn't it? Yeah. I think I've had 1 or 2 chopped off.
You're going to be in the UK?
No, I'm going to Italy for 13 days,
Right.
basically. I'm actually going to leave now. Our taxi's coming in half an hour.
Right.
45.
OK. I'll put it at the front desk in an envelope. You can pick it up when you get home, OK, from your holiday. OK.
Thank you, Doctor.
That's all right. Bye now.
How are you today?
Good, thanks. You?
Yeah, not too bad. The sun's come back out, so I'm happy with the
Oh,
sunshine.
good. You're going to have some time after your shift to play with it.
Well, I'll be home about 7.
Oh.
Does Sally want to sit over there? I was just getting you
Yep.
a seat, sir.
Oh,
Sorry,
thanks.
I don't know your name. So.
Keith.
Keith, hello, Keith. I'm Linda.
Hi, Linda.
And what's your name?
Thanks. This is Lily.
Lily. Hello, Lily. And which side do you want the injection?
Maybe the left, because I'm right-handed. That makes
Okay.
sense. Turn around.
That's fine then. You go that way then, Lily. That's right.
Is that enough room to get
That's
whatever
fine.
you need?
Only want the top of your arm. So I'm giving you a booster of your tetanus. We talked about it on the phone, didn't
Yeah.
we? Tetanus, diphtheria and polio, all in one. Sally came to see me because she needed some travel injections because she is travelling to Chicago in September to compete with the Great Britain blind sailing team.
I said what I was doing, didn't I?
You did, yeah. Wow. Exciting, isn't it?
Yes, I've just got to deal with the training now.
Sally was born with normal vision, but when she was about 6 years old, she contracted an eye condition called uveitis, which has left her with only 5% of vision. Is the training based in Bristol?
Some of it is. So we've just come from the swimming pool, actually, done 30 lengths. And yesterday I was doing some quite evil core fitness training to simulate racing a boat. So pulling a 40-kilo tyre around the gym.
Right, OK.
And then tomorrow I'm off to UK Sailing Academy to train with the Great Britain squad. So we'll be on the boats at sea. So.
Wow. And where's that? Portsmouth or something?
It's Cowes in the Isle of Wight.
Yeah. Nice. And you're going to have nice weather for it as well, so it'll
Yeah.
be lovely, wouldn't it?
As long as there's wind,
Yeah.
we don't care what else there is. But if it's sunny, that's an extra bonus.
It is, isn't it? I should think so too. So you OK with needles?
Yeah.
Yeah, all right then. I'm just going to pull your sleeve up a little bit there, Sally, all right? Here we go then, sharp sting. There we go, all done.
Great. Is that all right to put down,
That's
yeah?
all right, that's fine. So that would last, in theory, 10 years.
Great. Thank you for fitting me in so quick, thanks.
OK, it's a gold medal, won't you?
A gold medal. No pressure, no pressure.
No pressure, no pressure. Just a gold medal. OK, nice to meet you.
And you.
Bye-bye,
Thanks,
Lily,
Linda.
too. Bye-bye.
Bye.
Oh my God, look at these. Oh, these cakes look amazing.
I very rarely eat cake, and so it has to be really good before I bother.
Rarely eat cake.
Well, these are always good when Heather does them.
George Anderson, please. Hello, George.
Hiya.
Sorry to keep you.
That's all right, I was late myself, actually.
It's all worked out then.
Yeah.
Come and take a seat. How are you?
Extremely tired. I'm exhausted all the time. I don't know what's going on, but the right side of my skull is changing continuously. It's getting big bumps, big dips, hurts like hell. I have no idea what's going on. I haven't banged it or anything, but it's completely deformed. There's not an inch that is smooth.
and it hurts. Touch it and I scream sometimes.
Okay. How long has this been with you for?
Months.
Okay.
It's months.
Mhm.
Yeah.
Let's just have a look and see what's going on.
Yeah.
Have you found any bits that are itchy or any particular spots?
But they change continuously. Every day there's a new, and it's not like swelling because it's really hard. It just feels like the skull itself has gone over.
Well, there's nothing to be concerned about in the sense that there's no skin lesions or scalp lesions because some people get cysts or other things or spots or
Oh no, it's a very
something or
different kind of pain than the cysts.
But
Like
I mean, it all feels like a normal. It feels normal to me.
really. And this really gets me, especially in the evening. It starts to hurt, and I'll just brush my head or just touch my head, and I'm just like shocked at the amount of pain that there is. And I start touching, and I find all these painful spots.
So it might be what we call dysesthesia, or it's an altered sensation.
Yeah.
It's almost perhaps some kind of superficial nerve thing going on. But I think we'll just watch that. George is currently 59. He has quite a few complex medical health problems. He suffers from cluster headaches. He's hepatitis C positive and HIV positive. HIV, if it's caught early, is no longer a death sentence. In fact, people can live a near normal lifespan because there have been significant advances in the medicines used to control the rate of growth of the virus. I'm pleased to say that currently George doesn't suffer from any issues related to his HIV. It's well controlled. However, unfortunately, he has also been under significant stress recently, which has led to anxiety and low mood symptoms.
I didn't take the antidepressants at all.
Okay.
I made a conscious decision that because they take so long to work, and there's certain things that, they basically castrate you. I mean, your sex life just disappears. And that is one of the only things that actually keeps me alive and happy a little bit. And to eliminate that would be just dramatically wrong.
If you're happy not to start that, that's fine.
I need my faculties, and I actually need a little bit of extra emotion to get through something instead of just kind of letting everything just, which is what happens a lot of times.
That's quite a valid point, actually, because sometimes some people can feel a little bit subdued on them.
Yeah.
You're not vomiting? You're not waking up at night with headaches?
Not those headaches, no.
No. And no symptoms on your face or in your jaw or in your mouth?
No. Okay. No.
All right. Well, you're going to be due some tests and things when you go to the Brecon unit next week, but maybe we could touch base in 6 weeks or so, and you can keep me posted.
Yeah.
Obviously, if anything bothers you before that,
Yeah,
then
sure.
come in sooner.
Sure. That's it, yeah. Good.
Nice to see you.
Likewise.
Take care.
You too. Enjoy the weather while it lasts.
Laura Smith, please. Morning. All right. Just while I remember, I've got a message on my screen saying, can you go to reception after you've seen me?
Okay,
There's
right.
some message for them to discuss with you.
Yeah, all right, lovely.
Okay.
I'm just happy I got an appointment, to be honest.
Okay, what can I do for you?
So this pain, I've been getting it, my last 2 appointments, I had this spot of pain complaining about. I finally got my ultrasound tomorrow. Which is like a light at the end of the tunnel, but today it's the longest I've had an attack for. It's like, woke me up at like 5 o'clock.
What's the pain like?
Stabbing, I would say. Feels like it's in my back most of the time.
Right, okay.
But then it's also down here. Sorry, Craig's killing me.
Oh, dear.
Sorry.
That's all right.
I don't normally get weepy, but I think it's because I'm not
does it?
sleeping.
Yeah.
But hence why I made the appointment, because I haven't ever gone 3 hours in that amount of pain. Tramadol isn't doing anything. My mum has been giving it to me since it started.
Right.
But and I'm also concerned, what do I even do once I've had the ultrasound? How do I find out? Because I just want it gone. I don't know what it is.
Okay.
Sorry. So I haven't ever gone 3 hours in that amount of pain. And I don't know what I'm doing to kickstart it. Or this is what the ultrasound's for, I suppose.
Yeah.
When I was saying I think it's gallstones, and I'm thinking, well, normally food or something kicks that off, and I'm not doing anything to start this pain off, so...
Right. When you get the pain, you use Tramadol.
Yeah, but I'm taking Tramadol as more of like a prevention.
Right.
Because it's pointless taking it when you're having the attack.
And when you're taking it, how many are you taking?
I'm only taking 2 a day because it keeps making me constipated.
Yeah. I think rather than taking it to try and stop it coming, I think we need to try and take it when it comes.
Really?
Yeah. I just want to have a little look at you. OK, if you jump up on the bed for me to feel your tummy. So have you got the pain now?
I can feel it in my back.
In your back.
But it's more of a niggling. It's not like the agony that I'm getting.
I'll just have a little feel around. OK. It's all there.
Yeah.
Yeah.
Sorry, I tense up.
That's all right. That's fine.
Yeah.
OK. Would you mind just doing a urine sample just to check we're not missing anything in your kidneys?
Yeah, if I can get anything out.
So if you go and do that now and come straight back in.
Yeah. That's literally all I got, I think.
Yeah, that's fine. That's all I need. OK. Have you got your period at the moment?
No.
No. OK. So there's 2 platelets of blood in here. I don't think it's a urine infection, but I'm going to send it to the lab just to be sure. OK. One of the things that can cause sort of loin pain going through to the back, is kidney stones, and that can cause blood in the urine. OK. So I think what we need to do is wait for this scan tomorrow. Yeah. If it shows gallstones, fine, then we refer you to have it removed.
OK.
If it doesn't show anything, I think we'd then need to consider, do we need to do a CT to look for kidney stones?
Yeah.
In the meantime, I can give you a small supply of tramadol, but like you say, they are very addictive and they do cause constipation.
Yeah.
OK. The other thing I could give you that does work very well for gallstone-type pain is a suppository. So I don't know how you'd cope with that, how you'd feel about it.
No, I'm fine with that.
Good.
But if it's lasting this long, Oh, sorry.
It's all right.
I think I needed a bit of a rant as well.
That's OK.
Yeah. Thank you.
No problem.
Thank you so much.
No problem.
Have a nice day.
You
all
too.
right.
Bye-bye.
Snapped a cyclist.
Oh no!
I stood waiting for my bus and I'm looking up the road and the bus is coming down the road
And you put your hand out.
and I put my hand out and I went like that.
Ah!
But he was
Did you knock
coming...
him off his bike?
No, he was pushing his bike up the road on the
Hello.
wrong side of the road.
Well, there you
So
go then.
You had a nasty injury, didn't you?
I did. I've just been up to see the consultant. He's just taken the stitches.
OK. It was a bike accident?
Yeah, came off the bike and displaced the shoulder, so they've put it back. I went for a CT scan at the RUH, and that was why I was coming back, really, because they said you might want to go see the GP just to check. Because I told them that I get these really bizarre headaches, but I get a line across my eye. But it's not blurry, it's just a complete blackout of half of my eye. Not 2, it's only usually the 1, usually the left.
OK, because that's an unusual pattern for a headache or a migraine or anything like that, because normally the headache or a migraine, what you're talking about is a loss of a field of vision, and it will be the same field irrespective of which eye is open.
No, it's not.
How long have you had the headaches for?
This has been going on months and months.
How often do you get them?
Probably 1 or 2 a month.
How long do they last for when you get them?
The intensity lasts about 10 minutes, and then I'll either go to sleep and try and sleep it off, or it tends to just fade off.
Do you feel sick with the headache?
Sometimes a bit
Do you
sick.
actually vomit
No,
or not?
no.
That's migraine, my book. OK,
Yeah,
so a visual warning,
Yeah.
followed by a nasty headache
that's what I
with some
assumed,
nausea.
yeah.
That
Yeah.
sounds like migraine.
Yeah.
OK. So one of the problems with doing CTs of people's heads, and you might do it for one reason,
And find
it
something
finds
else.
something else. We call this the vomit syndrome. Vomit stands for victim of medical imaging technology.
Okay.
So this might be the vomit
All right,
syndrome,
yeah,
I'm
that's
afraid.
fine.
So this is an important bit. So there's no bleed inside your head. Grey matter and the white matter looks normal in the head, so that's,
Yeah.
the thinking material. Down at the base of the skull, they're saying that there's something that looks a bit funny, and it might be it's a blood vessel that's slightly enlarged, or by lacunar infarcts, they mean a type of stroke.
What are we talking about?
I've had a slightly bad back for a few months. Sort of stiffness, stuff like that. Nothing too major, just, you wake up in the morning and it's always kind of there.
Yeah.
But then a week ago, last Sunday, I played cricket on Saturday, felt fine, and then on Sunday morning I woke up and couldn't tie my own shoes, never mind do much of anything.
Sure.
And it's been like that for about a week now.
So you've had the stiffness in the back for the last 6 months or so?
Yeah, I think it's a long-standing 6'3", lanky, don't sit in chairs properly, bad posture all my life and all that kind of stuff, and it's just finally caught up with me. And then I changed jobs last year, and I think I just didn't have a very good setup at work. The wrong chair and this, that and the other for a few months, and it's just kind of brought everything to the surface a little bit.
But the stiffness is different from pain, or...?
This feels different. It feels like an injury, like a muscle tweak or something.
Sure. And let me just double check. The pain's just in the back. It's not radiating into the legs.
No, it's all lower back. The general stiffness I've had from a few months tends to be lower back, but depending on how I sleep and stuff, it can be a bad neck and other things.
Let's just lift this leg up. No weakness or numbness or tingling.
No, not that.
And peeing and pooing normally. Just checking the nerves are all okay. Stand up for me. I'm just going to press all here if that's all right. Is it sore in the sides?
It's not sensitive to touch or anything like that.
Is it sore in there at all?
No.
Just touch your toes for me.
Not a chance.
Are you quite inflexible?
I'm fairly inflexible anyway, so there's no chance I'd be able to
stay sideways and just
my toes, but
just
quite
bend.
Whereas I get to about there and it starts to hurt, and if I go much further, it's going to.
Would that be your normal range of movement? Do you think?
No, it's a little bit. Well, I'm somewhat inflexible anyway, I have to admit.
Sure. And in terms of, I'm just looking at your medicines, you're not on anything regularly?
No, I've been taking ibuprofen for a few days.
Yeah. Well, do you want me to give you some stronger anti-inflammatories then?
That might be worth trying.
OK, well, let's try that. I think that it is likely that you've just tweaked it. There's no worrying signs of it being affecting the nerves, which is the medical worry for back pain. So I can just reassure you that it should all just settle down. So that's what's happened just in the last week. In terms of the last 6 months, though, I'm hearing that it may be that this is a stiffness problem and that there may be some underlying issue there. Now, there is a condition of stiffness in the morning that affects young men and causes back pain. And I think if you've been having that, then it would be a reasonable thing for us to check a blood test and an X-ray.
By all means,
The condition is called ankylosing spondylitis, which is an inflammation problem, and that's the thing that we just need to make sure that isn't there. And, you know, it's quite likely that that's not going to be the case, but I'd just like to make sure that we get the blood test and the X-ray, and then get you back in to see your own doctor with the results of those tests in a few weeks' time. All right? If any other problems in the meantime, then let us know, but I think it will all just settle down with that plan.
OK, great. OK, great.
Cheers. Hope it settles down.
Cheers.
Bye.
I would be astonished if you'd had stroke, really. I mean, it seems really unlikely. You're very young, you're very fit, you're very healthy. There's no reason why that should have happened. What we do need to do, having got that report, is just do a quick neurological examination and get blood tests and check your blood pressure to make sure you've got no risk factors for developing a stroke. OK?
Yeah.
Let's do the blood pressure first, actually. Is this all making sense?
Yeah.
Let's put it round here. Yeah, OK. Have you been back on your bike since?
No, I did ask, and he said, I prefer you not to go on for at least 6 weeks.
Okay, that sounds sensible.
Yeah.
So that's a normal blood pressure. OK, so that's very reassuring. OK, I'm going to shine some lights in your eyes next. We'll turn the main lights off for this. So we're looking for the nerve head, if it's bulging or not. That looks absolutely normal. That's fine. OK, a bit bright suddenly. OK,
yeah.
So look at me, and I want you to follow my finger with your eyes. Do you see double at any stage while you're doing this?
No.
I want you to raise your forehead up. Close your eyes tightly. Don't let me open them. That's fine. Show your teeth. Blow out your cheeks. So I'm just going to feel both sides of your face. I want you to tell me if it feels the same on both sides.
Yeah.
Feel the same? OK. Just squeeze my fingers as tight as you can. The neurological examination is normal. The blood pressure is normal. We should just check some blood tests looking for other things that can predispose to stroke. So we're talking about raised sugar levels. We're talking about your cholesterol level. I imagine it's all going to be normal. It would still be good to just find out a bit more detail about the headaches. I'd like you to just clarify the visual symptoms a bit more and let me know after you've had the next one. I'd like you to keep a diary of when it happens, and I'd like to know a bit more about where in the head it is when you get it. All right? You can give me a ring to tell me about a bit more about the migraine once you've
I will
had
do.
another one.
All right,
Okay.
Thanks then.
Sure then.
Thank you.
I hit my knee like that, but look, Lynn, it's a big lump already. And I said I might have to come in on crutches tomorrow. The patient said to me, you need a doctor. I went, they're too busy for me.
Have a seat. So I'm presuming this is about your leg.
It is, yes.
Because it's a bit of a mystery, really, isn't it?
Yeah, have the scan people sent the information?
Yes, so they said there's no sign of a clot.
No.
Which is good. Yes. Possibly early cellulitis.
It's just got worse. By the end of Saturday, it was extremely painful. And now the pain goes from the toes all the way up to the top of my thigh.
Right, so where is the pain?
It starts off because I've got pins and needles in the toes anyway, I can hurt.
And what's that from?
Don't know. When I drove home from work Sunday night...
Have a look at the other one.
I struggled to feel the clutch. It's old colour now, isn't it?
It is. That's exactly what I'm thinking.
Yeah, weird.
How long's that been for?
The last 24 hours, I suppose. Looking for a pulse. Yeah.
I'm pretty sure I can feel a pulse.
Yeah.
Yeah?
That's good.
Yeah, it is good.
It's good news. It's alive.
I don't like the look of the colour.
No.
What I'm going to just do is see if I can find a nurse to just check. We can hear a pulse as well. Right. OK. OK.
I'm feeling quite hot again now.
Sorry?
I'm feeling quite hot
You're
again.
feeling hot. Come in.
Hello.
Thank you very much.
Hi.
Hi there.
So he's had pain and swelling in the leg, and we've ruled out a DVT, but it just looks a different colour.
Yes, it looks very pale.
Yeah. I think I can feel them, but I'd just like to hear it. Is that Saul just doing that, is it?
That's all right, sorry.
All right, huh?
That sounds right, doesn't it?
Yeah.
That's good news.
Fine, all right.
Thank you.
Just reassuring, isn't it?
Yes.
Fantastic, thank you. Right, OK. What I want to do is ring and speak to one of the vascular surgical doctors. I don't like the look of the colour of that. I don't like the sound of the pain either.
Bit out of puff, aren't you?
I am, yeah.
Why are you here?
Yeah. About a fortnight ago, had a bug, bad, sweating. My chest has just got slowly worse and worse and worse. And last night I just more or less sat up all night just coughing.
Right.
Breathing's difficult as well. I'm trying to cough to get some up, nothing's coming up. But I can feel it rattling. Excuse.
OK, have you got any history of any breathing problems?
No, never.
OK, do you smoke at all?
No.
Have you ever smoked?
Yes. 12 years ago.
You gave up 12 years
Yeah.
ago? How long did you smoke for?
Since I was about 15, 16.
Have you noticed yourself wheezing at all?
Yeah, I am wheezing.
And how many did you used to smoke a day at the most?
30 to 50.
30 to 50
Yeah, when I
a
was
day?
smoking, yeah.
How do you find enough time in the day to smoke 50
I used to work
cigarettes?
on the markets, so you get there at
Just
6 o'clock in the
constant
morning.
train. Fair play for giving up then, well done.
Yeah.
What made you give up?
Grandson coughed watching Thomas the Tank Engine in front of me and had a fag in my hand, and I said, that's it, finished.
He coughed in front of you
in
from
front
you
of me.
smoking?
Yeah, and I stopped.
Right, so we have this thing that we call pack years. So we work out your smoking history based on the number of pack years of smoking.
Yeah.
So the calculation is based on 20 cigarettes a day. So if you smoke for 10 years and you smoke 20 a day, that's 10 pack years.
Yeah.
OK, so let's average at 40. So you've got 68 pack years of smoking.
Not proud.
That is very significant
I know.
smoking history.
Yeah.
So anybody who's smoked for a long time has a significant risk of something called COPD, chronic obstructive pulmonary disease. So it's basically where you've got permanent damage to your lungs.
Yeah.
It makes you a lot more susceptible to chest infections and things like that. So pop your finger in there for me. Let's check you over now anyway. You look quite well, so hopefully
Yeah, I
it's
feel well.
not anything sort of like pneumonia or anything, but I'm going to have a listen to your chest. Right, have a stand up for me. Right, can we lift your T-shirt right up? Right, nice deep breath. So we're listening at the back. Try and touch your elbows together in front of you. OK, so you've got some crackles lower down on this right-hand side. I think you've definitely got a bit of a chest infection.
Yeah.
It would be wise if we give you some antibiotics.
Yeah.
And then once that's clear, you need to come back and have a review of your breathing again.
Yeah.
And if you're feeling worse at any point, rather than getting better, make sure you come and see us again.
OK, thank you very much.
That's really helpful. Thank you for your help. Yep, bye-bye. So he was really helpful, the vascular doctor. He says The colour can alter and be very pale and dusky just from the swelling, and the fact that we've got the pulse means the blood supply is okay. So that's
good.
That's good news.
Good news, yes.
Can I have a quick feel?
Yeah, of course, yeah.
If you can lie on the bed, that'd be good. Where does that hurt?
Hip.
Hip. Okay.
I can lie down. Hang on.
You all right?
Back of the ankle now.
Okay. Right. All right. You haven't fallen at all? No. Okay.
I wish I had.
Yeah. Can we bend your leg at the knee? Yeah. And no. Where does that hurt?
The muscle that goes all the way up to my bottom.
All right. Up you go. With Raymond, we'd ruled out a clot in the leg, which was an important thing to do. But when I examined him on the bed, he could barely move his legs at all. He was obviously in significant pain. I was concerned there was either some hip problem going on or a problem with the lumbar spine. I think we need some more imaging today. So I think the best way of doing that is going to A&E.
Suss it out.
Right. I really hope they help us get to the bottom of this.
It would be good. It would be really good.
It would be good, wouldn't it? Okay.
Thank you very much.
That's all right. Okay.
Okay, thank you. Thank you.
All the best. Bye-bye.
Thank you.
No, you made me laugh. I don't know why I'm laughing.
Oh my God, I've just been sat in the waiting room laughing my head off. My sister put a photo of me on Facebook and eating a chicken carcass. And one of my friends said, "Is that a rat?"
Well,
And I said, "No, it's my sister." Oh dear. Anyway, right.
Well, good. I'm glad it's keeping you amused this morning.
Oh my God, it's so funny. I just have to show you. Hopefully, it'll make your day.
Well, it is quite a photo.
Oh my God. Sorry.
It's fine. It's fine. Keeps me going.
This is great.
How are you getting on?
My knees are, on the whole, a pain.
Sure.
Still very painful. So at Christmas, I had pain in my right knee.
Yeah.
Which then got better.
Yeah.
And then I had a very bad acute pain in my left knee.
Yes.
And that is what is giving me most of the problems.
Right. And we referred you for the MATS referral.
Yes.
And they will look at both. Now, the right knee was the one that showed bad arthritis changes in the scan.
Yes.
And a little bit of wear and tear of the cartilage in the middle of the knee. Sometimes that can get locked in between the middle of the bones of the joint and cause your knee to lock and get stuck in one position. And that sometimes then needs them to trim it away and clean up the inside of the knee with a little operation. Whether it will need you to have a scan on the left-hand side as well will be down to what the MATS team say when they see you, I would suggest.
I would say generally it is getting better,
Sure.
but it's really affecting my life.
I think there's a difference between the two things that are happening, because one, we know that you've got really bad arthritis, and that's a different thing that's causing the pain from the thing that might be causing the locking, which is the cartilage
Oh, right.
problem. So let's boost the painkillers, wait for the MATS referral. I'll see you in about 4 to 6 weeks when we've got that, and I'll organise the scan.
Yeah, that's absolutely
But please
fine.
let me know if things get worse or you're worried or something else, all right?
OK, yeah, that's absolutely fine. Sorry about my entry. My goodness, that's right.
Don't worry. Keep me going all day.
Good.
See you later. Bye.
Thank you.
Nice to see you.
And you, love.
Take care.
See you again as and when.
Bye-bye now.
Hello.
You say thank you?
Have a nice holiday.
Yeah, thank you.
Enjoy the rest of your day.
Thank you. Bye-bye.
See you. Bye.
phones are a bit quiet. Sorry.
Don't say that.
Oh, that's it then. I've jinxed us all. Hello, Fine and Mo Surgery. Nikki speaking. How can I help?
Come in, come in, come in, come in, come in. Oh, look how beautiful. And this is Grandma, yes?
Grandma. It's my grandma.
That's your grandma?
No,
it's your mother. Oh, thank goodness. I was about to say, you look really young for your grandma.
My mum, yes. It's my mum.
Better take a seat there, Mum. Now, let's pop her out of here, onto there, and strip her down, but leave her nappy on, please.
Okay, okay. That's
And we'll have a chat. How are things going?
it's all right.
All right?
She's good.
First, second, third, fourth, fifth baby?
No, first my baby.
First baby?
First baby. I'm
Wow.
43. Doctor, it's like...
43?
Yeah, it's like $1 million for
$1 million?
Maybe more.
Jeez. Wow. So you're a very happy mum.
Oh, yes, I am, doctor.
Are you getting any sleep?
Sometimes it's problems. She have a problem with poo, actually, you know?
Does she? Yeah.
Yeah, sometimes 2-3 days.
Breast or bottle?
No, now bottle, because I getting flu, so I have to take medicine, and after I'm stopped. I know, doctor.
Well, do you know, it's not unusual for babies to have, to have a cycle sometimes, which may take several days. Does she really strain when she wants to go?
Yeah, it's very...
And is it very hard,
Yeah,
the stool,
hard,
when it comes
hard,
out?
yeah.
Okay, we might give you something just to try and help
Okay.
that. Lots of hair.
Yes, she does.
So there's the fontanelle, that's the soft spot up there, that's good. Well, let's have a little look at your ears, so plenty of cartilage there. Let's have a little, I'll feel these ones now. Now this is where we see how strong she is. Oh! And you're going to lift that head? Come on, lift that head up. Whoa! There we go. Oh, now look at that. She doesn't want to let go.
Oh, yes, yes.
See, my children now 18 and 16, so they haven't needed this. Yeah.
So you forget actually how to put it now?
I can still... No, I remember how to do that. Now, this is the last one, OK? So this is the one that mums hate.
Okay, that's
This is called the startle reflex. And we sort of keep it there nice and we go, whee, and she startles.
Oh, yeah, yes. She always do like this.
That's good. OK.
So it's all right?
Yes. Perfect.
Perfect.
Do you want to put the clothes back on? OK, so that's good. So it was a normal delivery or was it cesarean? Normal delivery? Good. OK.
Yes.
Any problems since then? Wean, passing bowel motions?
Yeah, problem with the wee, doctor.
What happens?
How I can coughing.
And yeah.
It's
Okay.
gone.
So do you know what you need to do with that?
I'm exercise.
Pelvic floor exercises.
Yes,
Yeah.
I did, but it's
Really important. It means you need to do it more and more.
more and more.
Okay. And it's hard to remember to do it all the time.
Okay.
My mother-in-law used to, every time she stopped at a red light, so it would just remind her that she would have to do her exercises. So she'll be in the car doing this,
Yeah.
But you've got to remember to do it. So you need to make real effort. You need to do it all the time because you need to firm up those muscles again.
Yes, I did.
Okay.
Because absolutely.
That's a built-in babysitter. That's great.
Yeah, that's great.
That's for you.
Okay.
Okay, so you just need to go and wait again for the nurses so that they can do the immunisations, okay?
Okay, doctor.
Good luck.
Oh, thank you.
I'm sure you'll be fine.
Thank you, doctor.
Mum's here to help. She'll be fine. She's been through this already.
Yes, she is.
Look how big you are now, see? She must have done a good job.
Oh, yeah. Thank you so much for your help.
You're more than welcome.
Thank you. Bye-bye.
Bye-bye.
Nice to see you. So, firstly, thank you for having the blood test done. The results have come back and it's looking pretty good. All right. So we wanted to do the special checks of your memory today, Patrick, if that's all right. Patrick came in with his wife on this occasion. It was his wife who was concerned about memory changes. We decided to conduct a memory test. It tests higher functioning, things such as memory, so recall, and visuospatial functioning as well. Shall we make a start? Yeah. All right. Now, the first thing that we're going to do, I'm going to give you a name and an address. After I say it, I'd like you to say it, and then remember it, and then we'll do some other bits. And right at the end, we'll ask you to give me that name and address again, all right? So, here we go. John Brown, 42 West Street, Kensington.
John Brown, 42 Kensington Street. No, 42. John.
That's all right, that's all right. Stick with it.
Yeah.
Do you want to say it again?
Yes, please. Yeah.
All right, I'll say it one final time.
Yeah.
John Brown, 42 West Street, Kensington. Yeah. Over to you.
John Brown, 42 Kensington Street.
All right, you've got to remember that at the end of the other ones, all right?
All right.
No, don't go there.
Okay, all right.
Don't worry about it.
I'm not worried.
What's the date today?
19th. August.
What month is it?
August.
Yeah, and what year?
2015 or 6. No, 5 is 6 comes in it.
All right.
Which one is it, Patrick?
So, how's things been then?
All right.
Yeah?
Yeah, I'm quite happy with the treatment I've got.
All right, good. And no problems with your chest? No,
No.
nasty chest infections or anything like that? Okay. And so we need to do your blood pressure, so we'll do that.
I always get nervous when I have my blood pressure taken. I don't know why. It's stupid, isn't it?
Okay, that's not bad at all.
Oh, isn't it?
No.
Oh, good.
What was that,
144 over 67.
Oh, everything's okie-dokie.
Yeah, so are you coughing much?
Not really, no. I did, but a while ago, last time I came, didn't
spasms now.
I did last time, and she said I hadn't got an infection because she tested me, but I'm all right now.
So you don't cough on a daily basis or bring up any phlegm on a daily basis?
No.
Might have a tickle, like, you know.
Just more of a tickle.
Yeah, but I'm all right lately, am I? Better.
Do you manage to do everything you want to do? So sort of, getting dressed, bending
Oh,
forward.
yeah, no problem with that.
That doesn't make you
No, I
breathless.
hoover and everything else.
Sorry?
I hoover.
You hoover? Oh, good.
And change the beds.
all at the time, but,
I do all downstairs and then upstairs. And I change my bed and that.
It's only this year she stopped mowing the lawn. She doesn't do the lawn.
I've got a gardener now that comes and does it.
Excellent. So for 91, you're doing really well, aren't you?
Yeah.
Beryl, you seen a nurse today or a doctor? Nurse report, yeah?
It's just kind of going.
Go on, I'll find you somewhere.
It's all right.
Go on.
Thank you, darling.
See you in a bit, darling.
Thank you, darling.
What we're going to do now is I'm going to draw a circle, and I want you to think of this circle as a clock face.
Yeah.
Can you draw in for me the numbers that you would expect to see on a clock face? Lovely, thank you. And now what I would like you to do next is, can you draw in the hour hand and the minute hand so that the clock reads 10 minutes past 11 o'clock? Fantastic. Well done, thank you. And now, back to the name and the address that I gave you right at the beginning.
John Brown.
Yes?
I don't know, can't remember the number, but it's West Street. We go further than it. It must be 2016. 2016.
Okay. Fine. Let's have a look. Let's total your score up. That's all the bits that I need to do with you. Thank you. OK, so that's not such a bad score, actually. Memory loss doesn't necessarily mean you have a diagnosis of dementia. There are many other reasons why somebody's memory could be affected.
As GPs, we would be looking for the reversible causes, so physical conditions, which may include things such as problems with a person's kidneys or their liver, thyroid problems. Could the patient possibly be having an infection? Things which are treatable, which are reversible.
OK, over to your wife. Some questions here. Would you say Patrick has more trouble remembering things that have happened recently? Yeah. Does he have more trouble recalling conversations from a few days ago? Yeah. And when he's speaking, would you say he has more difficulty finding the right word? Yeah. OK, so...
Gets very tired in the afternoon.
Right.
Very tired.
OK.
Sits down like that, and it's gone.
Right. So, in terms of the memory, that's what we wanted to kind of focus on today. It certainly looks like there might be some changes occurring to the memory. How would you feel about having it further looked into by a specialised memory clinic?
Local.
It is local. They can do really thorough assessments for patients.
Yeah. OK.
All right.
Thanks ever so much.
You're welcome.
With regard to John Brown.
I will do. I'm really glad you remember that one. That's good.
Good.
Well done. Take care, guys.
All right, thanks a lot. Bye.
Ladies, whatever you do, don't fight over me.
I'm sorry, I'm just in the middle of doing something.
I'm thinking one of them's going to give me the eye in a minute.
If we don't put the note on at the time, we forget, and then that's it.
Of course.
Don't remember to get 2 bags. Otherwise, you got to remember to get 2 bags, as you won't get one.
Alan Tilbury, please. Hello, I'm in here. Come and have a seat. Right. Is this about blood tests, yeah?
Yes.
Diabetes, yeah?
I've got on well with that tablet.
It's down a little.
Well, it would be, because it's working.
I think that might be overstating the case. Yeah, it's moved from nearly 100 down to 93, so that I really can't say that it isn't moving in the right direction. It's nowhere near where it should be. Yeah?
Yeah.
So what we need to do, as always with the diabetes, is a plan, yeah?
Yeah.
I think that there are 2 options. There's the option that says that the gliptin has had a little bit of improvement, so maybe we should give it a bit longer.
Yeah.
There's the option that says the gliptin has helped a little, but you're still quite a long way off target, and we're running out of options. Yes. So do we think about insulin?
Right. I don't want to go on to insulin.
Mm-hmm.
I have to admit, I haven't eaten the right things.
Okay.
Yeah.
So you
I've
think
eaten sweets.
He's cut down,
chocolates,
but still eating.
Biscuits.
So your diet could stand a bit of improvement.
Oh.
Am I being polite?
A radical
And you see, it's that which is up here.
Okay.
And I'm thinking, you're a bloody idiot. If I'd have cut out the thing and done the test like we've done now,
you think it would be
I
better?
would have had an entirely different reading.
Okay, so the third way is that you stay on the gliptin, but that you work really hard on your diet.
Work a bit hard on it.
Is there anything I can do to help with that? Do you need to go back to the education?
Gaffer tape his mouth?
I can't do that, not on the NHS.
I'll let you.
No, believe me, I'd end up on the front of a paper somewhere.
It's me up here.
How can I help you?
I done the blood test yesterday.
Okay.
I don't know what's happened to me. You scared me. Is something wrong?
No, it's just it looks like you're very anemic.
That's why I'm feeling dizzy all the time, feeling tired, feeling sleepy, feeling,
Yeah, absolutely. You would be with the anemia of that degree. Any shortness of breath at all? Are you short of breath?
Yes, lots. Even when I'm talking, I can't keep it up talking because I feel like...
Let me just do your blood pressure, okay? And your periods aren't heavy?
Sometimes heavy, sometimes normal. Is a red, is normal.
So we're back to the, do you need any help with the diet? There's an education service run out of Upton where they give advice about diabetic diets, lifestyle education. Or do you know what you should do and you just need to do it?
He knows what he should do. He just needs to apply it.
Yes, I can tell you exactly where
you're going wrong.
Chocolate-coated peanuts.
I should get your diet sheet out again and pin it on the fridge door.
Okay,
I've still got my diet sheet.
So essentially you don't need me to get you any extra help.
No, it's me doing it.
We need a plan. I would have thought that the sensible plan would be to keep you on the pills you are on.
I've just...
Oh.
You say to me, Alan, next time you come here, I want to see that weight down. Yeah.
And I need to step up
You
in the mark.
say that to me, yeah, and that's been my job then to get that weight down.
Okay, well, that's exactly what I want you to do. I want you to get your weight down. So, the same medication, but why don't we say that we'll give this, 3 months? That's how long the blood test takes to change.
Yeah, that's fine.
I think that if at that point it's still running too high,
then you know.
Then insulin, I think, is probably the only way to go. Are you okay with that?
He just wants to know he's tried all avenues.
Which I think is fine. Now, if anything changes and you want to revert to the let's go straight to insulin, you get in touch with me or Dr. Allen, yeah? Does that work for everyone?
Yeah, sure.
Happy with that?
Yeah, that sounds good.
Lovely. You can escape.
Thank you very much.
With no chocolate peanuts, yeah? Go.
Thanks very much.
Bye-bye.
Thanks very much.
Bye.
Did you suddenly start to feel more like this, or has it been a slow thing?
No. Yes,
Slow.
Yeah, I think it's a sense of 1.5 years now.
Do you lose any blood from your bottom at all?
Just a little bit, sometimes, not all the time.
Not all the time. Any tummy pain at all?
Where?
Anywhere on your tummy?
Yeah, sometimes here, sometimes. Yeah.
Can I just feel your tummy? Is that all right? Put yourself up here. And do you take any medications like ibuprofen or anything like that?
Oh, yeah, ibuprofen or Anadine, yeah.
How often do you take those?
When I feel headache or something like that.
Is that most days or?
Yeah.
Put yourself up there for me. Just going to feel your tummy, all right? So where do you get pain if you get pain?
Not pain, just not pain, just when I feel tight, it's my body, my body hurt.
Okay. Okay, finish. Get yourself up. Oops. Let me just explain. It's the haemoglobin in your blood that's low, okay? Normally, the normal range is 115 to 165, and yours has come back as saying 54, which is very low indeed.
Carmina Puyu. This is Holly, who's a medical student sitting in with me this morning, if that's okay. How can I help?
Sorry about my voice.
Yes.
I have a very bad cold.
Yeah.
But this is not the worst thing.
Yeah.
I was abroad in my holiday,
Mm-hmm.
and I'm afraid I got urinary infection.
A urinary infection?
Yes.
Yeah. Mm-hmm.
I have a very bad pain when I'm urinating.
Right. Burning or?
Very,
Mm-hmm. Mm-hmm.
very bad.
How long has that been there now?
Since a week.
Okay. And did you get any antibiotic treatment for the urinary infection?
Yes. I had with me ampicillin.
Okay.
The problem is I still have the pain.
So you have the pain. And how many days ampicillin did you have?
So since Monday, I have a week now.
All right, okay. Mm-hmm. But no better. Okay. And is the pain in the urethra where the urine comes out, or is it in your lower abdomen, your pain?
when I'm urinating, you know, that feeling, feeling the bladder full, that specific pain.
Yeah.
And I feel like I need to go to the toilet every 10 minutes.
Did you bring in a urine sample with you?
No, not yet.
Can you do one now?
Yeah, I
Yeah,
can.
we'll test it, yeah. If you pop next door and just do a sample and come back, we just, so you just want to dip test it first, yeah.
Let me just explain. It's the haemoglobin in your blood that's low. I imagine that this has become so low very slowly, because otherwise you would be, if your blood count suddenly reached that level overnight or over a few days, you would be very unwell. You'd feel very short of breath, but you've compensated because it's happened slowly. So I'd like them to see you at the hospital. Is that okay? Yeah. Would you mind waiting in the waiting room then, and I'll just make that phone call. All right. Okay, thank you. All right. Sit close by and I'll come and get you in a second. All right. Oh, hi, is that ambulatory care? Hi, it's Dr. Marsh. I'm a GP in Slough. I was wondering if you'd see a lady who's 41 for me. She had some blood tests done and she's been found to... Well, her haemoglobin's come back as 54 and the blood count also shows that her platelets are a bit raised, so she must be losing blood from somewhere. But if that's a real result, then I'm a bit worried about sending her home because we don't have far to go if she were to bleed anymore. OK, that's really kind. Thank you.
So I want you to take this antibiotic called ciprofloxacin twice a day for a week.
Do you think it's needed to see a specialist?
If we referred you on the NHS, they wouldn't see you for something like this. They need us to go through the pathway. So the pathway is to find out what the organism is, treat you first, find out what the organism is. If it comes back as another set of antibiotics, we might need to change the treatment. And then we need to review you and see whether or not your urine is continuing to be clear. If you had recurrent urinary tract infections, depending on the culture results, then we would treat you preventatively. If you got another infection, then we would refer you, and then they would accept the referral from that point of view. They won't accept a referral out of pathway.
Okay, it is any difference on the... if I'm going to the private specialist? Because also they need a referral from here.
You could go yourself to a private GP and get a referral, but there's no medical grounds to refer you at the moment. We haven't done the basics. And to refer you without doing the basics, it wouldn't be a high-quality intervention. It'd be a low-quality intervention.
How would I know the result of the test?
You can ring in, or if that's abnormal, I'll be ringing you.
Okay.
So that's what we'll do, and then we'll see what the culture grows, and then we'll advise you. Okay? Okay. Thank you. You're welcome. Bye-bye.
Hello, Ollie. Let's go back in. So I've just spoken to them, and they're really happy to see you at the hospital. Okay, and they'll see you via A&E. So if you go to accident and emergency, someone is expecting you. Okay, I would go straight there.
So is this like a really serious? Because she's quite worried. She wants to know like.
Well, we don't have any answers at the moment because I've not got any idea really why you may have lost so much blood. I sent you to hospital because it was likely that there was internal bleeding from somewhere in the gastrointestinal tract, but I couldn't tell from the history where this might be. So I needed some more investigations. But don't worry, okay? Yeah? You're in good hands and we get this done as soon as possible. Without you coming to any harm because of the low blood count. Okay. There's someone's expecting to see you. A&E. Is that okay? Take the letter with you. All right, try not to worry. But it's a good job you came in when you came in, I think. All right. Okay, come back and tell us how you got on. All right.
All right, thank you very much. Thank you. Thank you. Bye-bye.
Bye. Bye.
I knew with being 17, it's got a decent aircon.
It does. It smells nice.
Jim's room's got a decent aircon and smells nice, though.
Jim's room always smells really nice, actually, thinking about it. What does he do? He must use about a bottle of air freshener every day. Spraying that room down.
How can I help?
Well, it's about my rib. I had a very, very painful rib yesterday. It was very painful. I could hardly move properly.
Yeah.
So I think what happened is the day before, I was doing some heavy lifting at the allotment. I've got a 5-gallon drum for water.
Yeah.
And I lifted that and a watering can.
Yeah.
And I think that might have done it. So
Right, yes.
It was quite worrying, though. It was
Sure, yes.
quite painful.
Yeah, step off your top. So just show me where it's hurting you.
About there.
Yeah.
Just about there.
Okay, so if you could put your finger on the most tender spot.
Yes, I was saying around about there.
There, okay, so let's just have a look, yeah. You're tender there.
Ah, yes,
That's tender.
That's it, yes.
Can I write on you?
Yes. Yes, I think you're reaching it.
How are you here? It's tender there as well.
Yes, it is, yes.
You're okay there?
Well, I can feel it, but not as much.
Not as much, okay. Right, so can we just lie over here? Okay, just get yourself comfortable. Deep breath. And out. If I'm pressing there, is that okay?
It was then, yes, yes. It's quite painful. Yeah, oh, yes.
Sorry.
Hello, mate. I'm all right. Sit yourself down there and we'll get stuck into your acupuncture and then you can tell me what else you wanted to talk about. 14, 20 and 21. How have you been?
Probably the last 3 weeks. It's been quite painful. I needed to get in to see you because the treatment does work perfectly.
Good, okay.
How you been?
Yeah, I've been fine, thanks, mate. Well, in saying that, I ended up in hospital at one stage. But,
Oh, really?
Yeah. But outside of that, yeah, been good. There's a spot here somewhere, isn't there?
Yes.
Tell me when I hit it. Good, okay, mate. Don't go anywhere.
No, I won't.
I'll be back. Did I tell you the story of when I once saw a chap and because I had to stick him in a different room and I didn't, so I dashed in, stuck him in there, and the way it was put on the screen, I then forgot about him. And that was about like 3 o'clock in the afternoon, and I went home at 6.
No.
My partner rang me at about 6. He said, "What do you want me to do with that chap you've got in room 5? I said, "Oh, please pull out his needles and apologise."
Yeah.
He did say it was the best acupuncture session he's ever had. I'll try not to do that for you.
So what I think you've done, I don't think you've broken any ribs, but you have some tenderness over the ribs. Most of your tenderness and pain is coming from the muscles between the ribs.
Oh, I see.
Now, these muscles hold the ribs in place, so even if you had fractured a rib, we don't do anything about it because they're held in place and they just heal up. It takes 6 to 8 weeks to do that. But it's the muscles between your ribs that are strained, and I think it probably had to do with that lifting. Because when you lift something away from you, particularly, your muscles have to work hard to splint your chest. And in working so hard, they sometimes tear little muscle fibers and they burst and they liberate their contents, and the immune system mops that up. And that's what causes the inflammation. But don't worry too much about it. It doesn't indicate that there's anything serious. It's just a consequence of an injury, like a sprain.
Yes.
You could help it by putting ice on it, and I give you a gel to put on it that might help a little. So ice and gel.
Yes, okay, I will. All right, thanks very much. Thank you, Doctor.
Yeah.
Very good.
Yeah, nice to see you.
It's quite boring, isn't it, this therapy?
Yeah. It's not so, because you can relax.
Well, you can, yes, that's true. So, Colin, I might get you back in a couple of weeks. Is that reasonable?
That would probably be spot on.
Yeah.
If you could do that.
Yeah. I'll write it down for you. Good. Fantastic. Okay, mate, they're all out.
Lovely, thank you.
It's your next appointment, so we'll see you then.
I'll see you then.
And hopefully a couple of these, we might get there again.
Yeah, I think so. Thank you very much.
No trouble. See you, mate. Bye-bye.
Yes, come in, take a seat.
Do you want me to talk or you?
Yes, please.
Okay. So we come today because she was on antipsychotics.
Yeah.
Oh right, she's come off them herself.
Right, okay.
They were making her like a zombie.
Oh, really? The quetiapine or?
Yeah,
Yeah.
I couldn't stay awake.
Oh, okay.
So I kind of stopped.
When did you stop taking them?
A few months. About July.
July-ish. Has that actually changed your mood though, or anything?
No, it didn't really affect my mood anyway when I was on them. It kind of just made sure I had less of the mood because I was asleep.
She was put on them because you heard voices and stuff, wasn't it? And saw things. You've still got the low mood, haven't you?
Yeah.
Have you still got the voices and things? Or?
Yeah, still got the voices, yeah.
Emily is a 17-year-old patient and she was under the child and adolescent mental health team for long-standing depression, but also she had been hearing some voices as well, and therefore she had been prescribed an antipsychotic. She also was being planned for an assessment for possible autism.
I mean, Em actually said that she knows they were the wrong thing for her, but she needs to be on something.
Like I stopped for a while, then tried them again to see if they were.
They just zombified her, and it was we lost her totally.
Are you still under the?
She's just coming up to 18. They will chuck her off the system.
Oh God, yeah, quite soon actually.
I know.
So there is an assessment being planned.
There is, but I think the time it comes.
Do you need a transfer to the adult services, or does
they
that
do
happen
that?
automatically from there?
Well, Emily's really worried about this.
I haven't talked about it with anyone. No one's talked to me about it.
Yeah.
But also the diagnosis you were talking about, that's like a child's diagnosis. So by the time I'm an adult, it won't really matter.
It's a massive worry for Emily that she's going to be chucked off the system.
Yeah. And have you got a follow-up appointment before you turn 18, or?
I'm going to ring them. She needs an appointment because really, even just coming off antipsychotics like that is not ideal.
Mm-hmm. If a patient gets caught in limbo between the child and adult mental health services, there is a risk of damage to their mental health, particularly because they may lose the continuous patient contact and consultations. They may run out of medications, and therefore we try not to let it happen as much as we possibly can.
Try and rearrange that appointment.
I will. I'm going to ring them today.
Do you want me to give you a call in a couple of weeks to catch up and just...
That'd be great.
If you could find out if they can automatically transfer you to the adult mental health services or whether we need to do a separate referral.
That'd be
if you find out...
Okay.
Just put you down for a telephone call. Is that all right?
Lovely. Thank you so much.
All right,
for
no worries.
everything.
I'll speak to you in a couple of weeks.
Yeah, thank you so much. Bye-bye.
David Smith. Hiya. Thanks for waiting. Come and have a seat down there. How are you?
The reason I'm here today is embarrassing and it's humiliating. Last week, I took my wife up to Coventry.
Yeah.
There was a problem on the M1 on the way up. Traffic was at a standstill. For half an hour, didn't even move. I was desperate for a pee. I had to get out of the car, stand by the door with a van behind me, cars all around me, and pee on the motorway. That's what I had to do, and I just shocked at everyone, went, you know. So what? And that's what I had to do, but that is bad. I'm 68 years old.
I used to see you for the prostate side of things.
That's
didn't I?
right,
And then we tried a few things, and then you ended up going under the urologist after that. Is that
That's right, yeah. I mean, that went on for years, though, you know. I mean, since then, I've had the gallbladder out and all that last year.
I just want to remind myself.
I don't know what's going on here, but it's totally, well, it's unacceptable, you know. To me, it is.
Yeah.
You know, 60-year-old man peeing himself, you know. I mean, it's just not clever. When I feel it coming, I've got to go immediately.
So how long has this all been going on for?
For a while now, you know. No one is more meticulous than me about personal hygiene. I hate it.
When they tested you last time, they found things like tightenings, what's called a stricture. So they found a tightening along the way that might have been part of the reason you were getting symptoms. They tried to rectify that by opening up the bladder, the opening of the bladder into
That's
the...
right, yeah.
And they also tried to dilate the
I remember them doing
ureter, So they tried to do that to try and make things better. So I wonder whether it's actually worth referring you back to them as well, rather than me messing around with medication.
Okay.
However, what we could do is give you medication to try and deal either with the prostate or the bladder while you're waiting for that referral. So at least you'll have done some of the steps along the way,
that may be helpful.
and doing your bloods and the PSA and all that stuff as well.
Yeah.
So I think that's probably the best thing.
Okay, I'll go with whatever you say.
Referrals.
I said to my wife, jokingly, I'll probably end up wearing adult nappies.
While you're waiting for the referrals, if things change or you're worried, come back to me.
Okay,
One of us.
Right, thank you, Doctor.
Take care, right.
Thanks a lot.
See
Thank
you.
you.
Bye.
Coffee, no sugar.
Do you want to?
Tea, 2 sugars. Does Charlotte want one?
No?
Who didn't empty their cup?
There was no need for that.
Sorry.
Have a seat.
Chris, I got myself in a mess. Right, my list. I'm in a mess.
Are you?
It's this foot. I came down the stairs, the last 2 steps, for some unknown reason, I just took off and landed on my feet. I lasted that night.
So you didn't actually fall?
No, I was on my knees.
You did, like...
Next day, A&E. X-rays, they said no fractures or muscles and tendons. They gave me cream and tablets. So here we are. But the pain, Chris, is gone from there to here to here. Now, it's all gone stiff and the skin is tight. How can I get rid of it?
Should we have a look at it? Do you want to pop on the couch?
Yes, sir.
In fact, if you could leave your leg here, I'll have a look over the weekend and sort it out for you and put it back on Monday, is that? That sort you?
Why not?
So this is the leg, isn't it?
Yeah.
So you say the skin is tight?
Yeah.
Does it just feels tight, yeah?
Yeah.
It's a bit swollen, isn't it, the leg?
Yeah.
It looks okay, though.
Yeah,
it's in good condition.
We're doing all right.
Yeah. It's not too tight, it's not too swollen. Calf's nice and soft. Skin looks okay. So I know it feels tight, but it's more of a feeling than it because it is swollen. Yeah. Do you want to sit yourself up?
Please, sir.
Here we go. There we go. That's it. There. So the main thing is uncomfortable, isn't it? The whole leg. It's just going to take time.
Is it?
Yeah.
So what do I do? Leave it alone now?
Best thing you can do is keep walking, keep mobile on it, keep doing what you need to do.
No gel. Don't know if you'll understand this.
So the IV gel, that's good. So I'll tick that, yes?
Yes, please.
Naproxen, no. Put a cross by it.
No.
The cocodamol, no.
No.
Put a cross by it. But you can have paracetamol.
Yes.
Yeah?
I've got some of them.
OK, so I'll write it down on here for you. Elderly patients, like lots of patients, are sometimes lonely, and the general practitioner is there as a friend that they may have known for many years and someone who is easy to have a conversation with. And I think lots of people find it reassuring to be able to talk to their GP about the ups and downs of life. This is one of the functions I think that GPs provide really successfully for patients.
Oh, dear, here we go.
You're doing well.
Yes.
And you're looking well.
Yeah, do you reckon?
I do.
People say that, but...
I do, yeah.
Anyway, I'll let you get on with these other people.
Nice to see you.
Thanks, Chris.
OK, I'll see you in 2 weeks' time. OK, I'll send you the appointment.
Lovely.
It'll be Friday morning.
OK,
take
sir.
care. Have a good day. Bye-bye.
Bye-bye. Do you want to shake hands? Bye-bye. Oh, it's lovely, yes.
Right, cheers for that.
OK, hope you feel better soon.
OK, see you later.
Take care.
There you go. All right. Take care. See you. Bye.
Bye-bye.
Bye.
Bye-bye.
Danielle Winter. Hello. Who have we got here?
This is little Harley.
Oh my goodness. Fast asleep and looking happy. Come in. It's a warm day for little one, isn't it? Oh. So, shall we start with you?
Yeah.
So, how did the birth go? Were there any issues or problems
No, the
or
only
anything?
thing, just halfway through, we decided I need to turn around. So it was, I think it's called face presentation,
Okay.
is it?
Oh no, it's hard to get out then.
Yeah, so that was the only thing, and it took a while. But apart from that, everything else went okay.
Perfect. And in terms of your bowels and waterworks, everything
all of
okay
that's
there?
fine.
No
Yeah, all of
troubles.
that's fine,
And down below,
all fine.
feels all right. You didn't have any stitches or
No,
anything
no
though,
stitches,
so
nothing.
perfect. Well, you're a natural, obviously. And how are you feeling in yourself? You
Yeah,
look
perfect.
well enough. Are you getting
Yeah.
some sleep?
I'm getting- he was
Or?
a bit naughty last night, but apart from that,
Okay. And feeding-wise?
feeding-wise, he's feeding a
Feeding-wise
lot.
is fine. He's taken to the bottle all right?
Yeah.
Perfect. So any concerns about him?
About, I think it was a couple of days ago, he did a complete solid pill, and it was really long, and it had blood in it. And I was a bit like, oh gosh. 5 minutes later, he just did a normal poo again, and he was completely fine.
Did that coincide with him going onto formula?
No, it coincided with him going on to an anti-reflex formula, and I didn't know if that was anything to do with it.
Probably, yeah, might be the
So I
change of
swapped
milk.
back to the colic and constipation one, and the poo was back to normal.
Yeah.
But,
So can we have a little look at him?
Yeah.
I'm so sorry to wake him up. Oh, look at him. Oh, look.
There we go.
Hello.
Check this out.
He's like, what are you doing to me, mother? What are you doing? I was fast asleep. There we go. That's
that
right?
right?
Yeah, that's fine. Where's your eyes? Let's have a look. Oh, yes, that's brilliant. Oh, I'm sorry. Is that a bit bright, was it? There we go. All right. Shh, 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 shh. Good boy. Hello.
There we go.
Gosh, he's strong.
Yeah, he was holding his head up for about 3 weeks. I was so shocked.
That's fine. Let's check your boy's bits. That does look like you might need to do a wee, so we'll stand back if we need to. Whoop. That's fine, both his testes are down. Let's check your legs. Have you got your red book anywhere?
Yes, I do. It's in my bag in the big bit, yeah.
Oh,
we don't like that sad face, do we?
Oh, I don't blame him. That was a bit mean. So, have you got an appointment for his injections yet?
Yes, I have, yeah.
Fine.
Yeah.
So, are you okay about having those?
Yeah,
Obviously,
that's
none of us
fine.
like to have our
No.
babies jabbed, but they'll explain to you when you come along.
Yeah.
And sometimes they can get a little bit of a temperature or be a bit grumpy,
The health
so you're
visitor
allowed
said
to
last
give.
week.
He's really gorgeous, aren't you, pretty boy? You are. We can say that when you're a baby, not when
Yeah.
you're 18. We won't call
No.
you pretty then.
Oh, thank
Take
you very
care.
much.
Yeah. Lovely to meet him. Bye.
Yeah, all right.
Hello.
Hiya.
Hello. Very good, so it is. Are you Cody?
Yeah.
Cody, who's this?
Mummy.
Mummy. Very good.
I brought him in a few months ago because his willy didn't seem to be growing with him.
It doesn't.
No, it doesn't seem to be growing at all.
No, it won't grow until he's about 11.
All right, okay. But he's been complaining it hurts quite a lot.
That's different.
And also his bum is also red raw.
Does he scratch it?
He's always irritating him, yeah. But he's just, for the last 3 days now, he's been complaining that his winky hurts. He calls it his winky.
Cody, what I want to do, please, is to have a look at your bum and your winky. Is that all right?
Yeah.
So now you take your trousers off.
No, give me shit.
All right. OK. Now, well, what I want to do, sweetie, I'm going to put you up on the bed because it's going to be easier for me. Here we go. All right. So first of all, we're going to look at your bum. Oh, he's scratching here and here.
Yeah, it's all around here as
He's
well.
very dry, so actually I'll give you something to put on there.
Okay.
Where does your winky hurt? Can you show me? It's a bit tight.
Okay.
That penis is perfectly all right for size.
Right, okay,
At
yeah.
his age.
Good boy, do you want to get your shoes on?
Careful, careful. Not my... Those are my keys.
Cody, can we get your shoes on?
Sorry.
So that's very nice of you to say sorry. Thank you. Where am I going to sit now?
Nothing.
I was going to give him some steroid for that skin, but actually what I'd like to do is just some moisturiser. It just feels dry.
Yeah.
And if you put some moisturiser, it may just make the itching go away.
Okay, yeah.
I'm going to be a doctor.
Well, I hope you have somewhere to sit when you're a doctor. You can use this as much as you want, so I would put it on 2 or 3 times a day.
OK, lovely. Come on, then. Are you taking your picture? Right, say thank you.
All right. Bye-bye.
All right, thank you. Say bye-bye, then.
Bye-bye. Bye-bye.
Thank you.
Polly, please. Come on through. And your grandmother?
Yeah.
Yeah?
Yeah.
OK. And Polly's how old now?
Coming at 4 months.
Yeah. And how can I help?
She's worried about her eyes. This eye, she'll open it really, really big and it looks bulbous.
OK.
And you can see all the white right the way round it, and sometimes the eyeball will sort of tremor a little bit.
And how long has Mum noticed this being a problem?
Well, when she was born, she had quite bulbous eyes. Do you know?
OK.
They were quite thin, but they settled down. We put it down to pressure and what have you. But about the last month,
About the last
month,
month.
She thought it was settled, but it haven't, and it's like a bit worrying.
And is there anything else that's happening at that time? Is any other limb shaking or anything like that?
Not that I've noticed.
OK, all right. And how's she fed at the moment? Is she bottle fed or breast?
Bottle, yeah.
And she's taking all the bottle feeds?
Oh, yeah, she's a greedy moo.
And nappies are all OK? Is it both the eyes or the right eye?
It tends to be the right eye, but
OK.
the left eye does it, but not very often. It's more the right one,
OK.
and sometimes it's squint right in.
OK. And is there any family history of any eye problems?
I've got eye problems myself.
Any squints in the family?
Yeah, I had bad squints.
OK.
I had surgery on them.
OK.
Yeah, she's just generally worried about it.
All right. So, let's have a look at Polly. If you pop her out and bring her onto the couch there, I'm just going to wash my hands before checking her. And no vomiting or anything like that?
No, nothing.
OK, so if you pop her up here. And no discharge from the eye?
No, none.
No. No, let's just have a shine a light in here. You're very cute, aren't you? We've got the eyelid on the right just seems a little bit lower compared to the left, and there might be a slight inturning of the right eye. Fine, and apart from that, she's absolutely fine in herself?
Yeah, yeah.
Fine, OK. Pop her up and let's have a look at her while she's sitting in your lap as well. That would be helpful.
Come on, love. Oh, come.
Let's just have a look here. So what I'm going to do is get what's called an orthoptist or somebody at the eye hospital who specialises in checking children's eyes in a bit more detail.
Yeah.
Is that OK? The letter should come through fairly quickly.
Oh, good.
So you've got her all day, have you?
Yeah, Mum's gone to work.
Right.
Gone back to work already.
Take care.
Thank you very much.
Bye-bye.
Thank you, bye-bye.
I gave birth less than 4 days ago.
Fair enough.
You're looking very well, I must say, considering I know what you've gone through. OK, so any hyphens or anything in between Clementine and Butler? No?
Just 2 separate surnames. One of them is Butler.
No.
What?
2 separate middle names.
Yes, what I meant.
That's not what you said.
Baby brain, we can allow
Yeah.
baby brain, yeah.
Hi there.
Hi.
OK. I wondered if you wouldn't be coming because I saw that the little one had been off to hospital.
Yeah,
Is that
on
right?
Monday. Yeah,
Yeah.
he was. Yeah, but I think
He's bounced
it was
back,
just
has he?
precautionary. Yeah, just in case he's little.
Yeah. OK. All right.
Yeah.
So you're enjoying being a mum?
Yeah, I think it's quite challenging.
Yeah.
Just because I obviously don't really know what I'm doing, and I was saying to my husband yesterday, in the day I don't know if I should be doing more for him because either he's eating, sleeping, or crying, wanting to be fed. I didn't know if there's anything I should be doing to stimulate him.
What more could you do?
Well, I don't know. There's times where I just think, OK, you're awake now, what should I be doing?
Just, I mean, interact and do as much. You just grasp those moments and do what you can, really. And then, yeah. I mean, the time will come when you've got a little bit more time. But so you went into hospital on Monday.
They just observed him and then they sent us home again. So.
OK. Has his breathing gone back to normal? It looks OK to me.
Yeah, he's definitely breathing a lot better.
Apart from having been in hospital, do you have any other concerns about him?
Only just about his head, actually.
Yeah?
We've noticed that his ear on one side is further forward than the other. We asked about it at the hospital on Monday and they just said it is because he is leaning on one side more than the other.
OK.
And he's flattened his head.
So they were relaxed about it and said it was...
Yeah, they had a good feel of his skull and said nothing seemed abnormal, but it said they said it was worth mentioning to you when I saw you.
OK.
So, yeah.
Right then, hello, mister. How are you? Who's mum? I'm mum. Your mum, OK. Do you want to sit on mum's knee? And then, are you Nan? No. Yeah, OK. Presume so, but you couldn't get that so wrong. OK, right then. And so this is Jonathan. Hello, Jonathan. How old are you? 4. Quite a big boy, aren't you? Yeah. That's good. OK, so he's eating and drinking right. He's been to nursery.
No, I didn't take him today.
Right, OK. Who's drawn the pretty pictures around it, OK?
See if we've got any bigger.
Right then, let's just turn you round a bit, mate.
Because he seems to be more appearing up.
OK. Are they itchy? No. Are you scratching them? No, not at all? God, they look itchy. I want to scratch them.
No, we haven't touched them at all. It concerns me.
Yeah. They've all got a central punctum. They've got one there, there's one there.
Yeah, they've all
got it.
Yeah.
Yeah, OK. All right, you don't know what it is. Anybody else got it?
No, just him.
OK. New medicines or anything? No. OK.
He's took his calpol.
OK. I can't put a name on that. OK, it may be bites. Children do come in and see us with rashes all the time. Most rashes are completely harmless and will just get better by themselves, in fact. And he's quite all right, playing... OK, all right. Of course, every parent worries about the rash that can be caused by meningitis. Meningitis is a rare condition. Each GP will only see 1 or 2 cases in their career. Parents should worry if their child has a rash and the child is not very well. The rash of meningitis is red spots on the skin, and the important difference between meningitis and most other rashes is that the spots do not fade when you press on them. You can stick his top back on and just keep an eye on them, OK? A well child is a well child. It'll probably just disappear by itself, OK? If it doesn't, or he gets worse, you bring him back. OK? Is that all right?
Yeah, that's
Thank you very much. We won't put anything on. I'm surprised they're not itchy.
Yeah, that's what I said.
You know they don't itch. OK, bye-bye.
Is he smiling?
He'll smile just really randomly, it doesn't look like it's a result of something that we've done. He just seems to smile.
He's 6 weeks and 1 day, so it's a bit...
Yeah.
It's right on the borderline, isn't it?
Yeah.
You happy with his eyesight?
He's definitely tracking us when we move around, and he does look at things that are making noise, but not all of the time.
No.
So I wonder about his eyes.
Do you want to get him out of there?
Yeah.
And I'll have him up on the couch to examine him.
Oh, yeah.
So, you're absolutely right about the ears. One appears to be further forward than the other. And I'm sure the hospital is right. It's because of this asymmetry of the skull, OK? Which is a common thing. And I imagine that this is just going to settle itself down over the next 2, 3, 4 months, actually. We'll have him back and have another look at that.
Yeah, that'd be good.
It's extraordinarily uncommon that we need to do anything about this. So what we're doing here, this is obviously not a full eye check, but what I'm doing is just checking I can see down to the back of the retina.
Oh, it's okay.
You're a wiggly boy, aren't you?
Oh.
So, eyes are moving, they seem to be moving together.
Yeah.
Pupils are the same size, and there's a clear view down to the back, so we don't think there's anything like a congenital cataract that would be obstructing vision there.
Okay.
OK.
You find your thumb again.
Hey, Ralphie. Hello.
Doing a fake crying now.
Yes, you are, aren't you? Let's just have a look at your spine. It's a nice mobile spine. OK, lovely. Dress him up. I'm just going to jot a couple of notes down while I remember them.
It's okay. There we go. It's all done.
He's a lovely boy, isn't he?
Yeah. When he's calm.
When he's calm.
Yeah.
It's always nice when they're calm, isn't it? And listen, I should see him again, all right? Need to check that he's smiling properly, which almost certainly will go with following with his eyes as well. Those two things tend to go together. So if you can book an appointment for him to see me in 1 to 2 weeks.
Okay.
All right, Alfie? Time to go.
Your chair. Uh-oh, chair time. Let's see how we go. Thank you.
OK, you're all right.
Yeah,
Let me do the jaw, because it's quite heavy.
Thank you very much. See you again.
So you book that appointment on the way out?
Yes, I will
OK,
do. Thank
cheers
you.
then. Bye-bye.
You ready to read it? Okay, here we go.
Little fish.
I don't know, that's why I bought your book to read. I'm Dr. Graham. How can I help?
We've been on holiday for 2 weeks, and while we was away, she was complaining her ears were hurting.
Yeah.
I had an audiology appointment with her today.
Yeah.
So we went down there, and he said that her right ear is blocked.
Yeah.
And the left ear, it looks like something going on infection-wise.
Right.
And he says that I needed to come and see you.
And do they hurt both ears at the moment?
Which ear hurts, Robin?
That one.
Yeah, the right ear.
Does it hurt if I press here? Does it hurt at the back? The ear canal is quite red and there's a bit of pus in there.
Right, OK.
So she might have had an infection behind the eardrum that's burst.
Right.
And then left some
gunky
stuff in the ear canal. Should we look in the other one? For you to stand up, I think it'll be easier for me to get round it that way.
OK.
And this one, if I press here, does that hurt? And that there? Nope, good. I would actually say that one looks pretty all right.
OK.
She needs to have some antibiotics for that side because that's an infection.
That's the side where she's got mild hearing loss in?
That side?
Yeah.
OK. Is she allergic to anything?
Not that I know of, no.
So we normally give amoxicillin, all right?
OK, yeah.
So this is 1 spoonful 3 times a day for 5 days. She should probably keep the ear dry, maybe for a couple of weeks till it's fully better. Is that all right?
Yeah, that's fine.
Good.
Who do I need to see about speech and language?
We could talk about it now if you want.
Yeah?
Yeah.
She's very still learning to pronounce words.
Yeah.
So she can't say things like her brother's name is Jackson.
Yeah.
She says Jack's-done.
Yeah.
So her development in school is perfect.
OK. Does the teacher have concerns
No, they
about
haven't
it at all?
said. No.
So it would be worth talking to them because
Okay.
there's a very wide range of normal and a small problem like this when everything else is fine will sometimes just improve with a bit of practice. But if the school is concerned and thinks that she might benefit from speech and language, then they might want to write a small report, okay, to us. How does that sound?
Yeah, that's
Is that
fine.
all right? Because it
That's
sounds like otherwise she's doing really well. And at her age, it's all right to get quite a few things slightly wrong.
Yeah.
Is that okay? Good.
Right, say bye. Say thank you, Dr. Graham.
Bye.
Bye.
Ezra.
Oh, yeah, sorry.
Come on in, come and take a seat.
Thank you.
I'm Dr. Ahmed. OK, so how can I help today?
Well, basically, he's been sick every morning this week, once in the evening, which was yesterday.
So when did the sickness start?
It's literally been like a week. I've not really took notes because I thought, you know, babies, they are sick, so...
So vomiting started...
Yeah, I'd say roughly about a week, but it has been noticeable because it's not normally his character.
OK. When he's been vomiting, has he been vomiting every morning? Or
Pretty
throughout
much.
the day?
No, it's normally just the mornings.
So it's just once a day, usually?
Yeah, yeah.
Is he taking his sort of solids at the moment?
Yeah, but he refused breakfast the other day, so I had to just leave him, but I've been trying to do little and often.
Any temperatures?
No, not that I've noticed.
OK.
He has fell a couple of times on his head.
Tia, please.
Yes. Tia. Here we go.
Hello.
Hello.
I'm Dr. Jewell.
Dr. Joe. This is Tia. She's got a bit of a funny chest. So I just want to check it out. Really.
Okay.
She's been coughing now for over a week, but we've been away, so that's why I haven't brought her down before.
Where have you been?
Isle of Wight.
Oh, what was it like?
Lovely hot weather. Absolutely lovely, wasn't it?
Apart from coughing, has she been all right?
Yeah, she's had a bit of a runny nose a bit, but when she's asleep, she's breathing really like that kind of thing. And then in the morning as well, she's really trying to catch her breath. But then throughout the day, she's all right like this. But
Active?
Yeah.
Obviously very active. Eating all right?
Yeah.
Playing?
Yeah.
Right, let's... She's got a bit of wheezing on this side. It makes life a little bit difficult. Well, it doesn't really. It suggests what we might do about it. 6, 7, 8, 9, 10. That's okay. We all worry about children because we know they can get ill very quickly. Now, the ones we worry about are the ones who are very floppy or pale or not responsive. If they haven't eaten for a while, they've stopped playing, those sort of things. And although we ask questions about it, it's a kind of judgment you make just the moment you see a child. And you make the judgment almost as soon as the child comes in. Is there asthma in the family?
I have it slightly, and my husband does as well, and my son.
So do you have lots of inhalers and equipment and stuff in the house?
Yes, we do.
And you know how to use them? This
Yes.
is great. This is fantastic news. I'm sure it's not a chest infection. She's much too well for that.
Yeah, that's right then.
I can hear the wheezing. And as you probably know, people who have asthma, it's worse at night often.
Yeah.
Now, you can't diagnose asthma in a child of this age. But she has got some wheezing, and I think the sensible thing is to treat that.
Okay.
And if you're very familiar with inhalers and things, we could do it that way. Are you happy with that?
Yeah, that's fine. Yeah.
Now, do you use spacers?
Yes, I do.
I haven't... There's nothing I need to teach you. It's wonderful. Will she tolerate having the mask over her head?
You never know until you try. Right, can I pop you up? We can go.
Now, you know also, if you're treating somebody with wheezing and they're getting worse, that's an emergency.
Okay.
You know that?
Yes.
Thought you would. You're being very kind to me, and sort of pretending, half pretending you don't really know this stuff. Tell me.
No, I do know.
Here's the critical question.
Yeah.
Had you decided, when you were sitting out there, that what you needed was to go out with this before you even saw me?
No.
You didn't? Oh, well, it's very, very decent of you to say that.
No. Thank you.
Good.
All right,
I hope it does the trick. Good.
Thank you very much.
Bye-bye.
Right, come on. Come on.
It's just on the shelf. There's a train. Yes.
What's this?
Very important. This patient said, "Where is your train?"
That's so funny.
He has fell a couple of times on his head. I know I'm being a paranoid parent now.
That's
but
all right.
I obviously Googled and was like, the
Okay,
symptoms.
all right. When did he last hit his head?
Oh, it'll probably be a couple of weeks ago. He fell off the bed. It was just straight down onto the bed. It's like sofa level.
That was 2-3 weeks ago, and this kind of vomiting thing's
It's just
not going to be
coincidence, isn't it?
related to
Yeah.
that.
The only other thing I've noticed is, I don't know where, because I'm not a doctor, but this is slightly raised. I know he's had that for a while.
Okay. So you're worried about a collection of all these sort of...
Yeah, because when you go into Google, it's like water in the brain, and I'm like, oh my gosh, what have I done?
Okay. The internet can cause undue stress and concern. It's also a great source of information, but one of the things we try and do is signpost patients and parents to NHS-endorsed websites for appropriate information. Do you want to just pop his things off?
Yeah, I can do it
right
here
down
or-
to nappy level.
Do both
Mind the
ends,
edge
to be
there.
honest.
Yeah, no, actually, quite a bit actually. Mobile babies and children are always bumping into things, and this is part of exploring the world that they're in. With regards to head injuries, if a child is acting out of character, for example, more sleepy than usual, or vomiting, or just not being their usual selves, I would seek further advice. You know, I think he's fine, actually. If he's eating and drinking, there's no vomiting during the day, his nappies are fine.
Yeah.
I can't quite explain this one-off vomit in the morning, but if it's just a once-a-day vomit in the morning, the rest of the time there's no temperature's fine, so on, I think we'll just wait and see.
Okay.
And in terms of sort of lumps and bumps in the head, I mean, his head looks fine here. That's the shape of his skull, isn't it? And
Yay, just a bumpy head.
he's fine in himself.
But yeah, thanks for seeing us.
No, not a problem. Do you want to... Are you okay doing it there? Yeah. Become expert at doing that.
You are?
No, I said you become expert.
Oh, right, I thought you said you're an expert. I was like, feel free. No.
That's okay.
Do you mind just...
No, that's all right.
Awkwardly bending his arm
You've
into
got
his
a
jacket.
nice red coat there.
All right, we're going now.
Right, now we have objection.
What's to stay with you?
Take care.
Bye.
Bye. Bye-bye.
Oh, you're normal. Yay.
William. All the way down here.
Here we go, little man.
There
we go.
Right
quick, can we come?
Take a seat a minute, and then we'll just have a chat about what he's doing. Right then, so it's his 1 year IMS to do. Yeah. And he's going to have 4 injections, all right? A booster of his hib, but also with the meningitis C, and then the new one, the MMR, so the mumps, measles and rubella, okay?
Yeah.
So it's a live vaccine. 24, 48 hours, may get a bit of a temperature, maybe just a bit off, you know?
Yeah.
Not, you can't do anything right, you know? Not allergic to anything that you know of?
No.
Yeah,
You're
lovely.
going to be a big boy, aren't you?
Yeah, it's going to go in his legs, so 2 in each leg, obviously. Because he's nice, big and strong now. We'll have to keep a hold of him because he's going to get
I've got
really...
2 others, so I've got a 5-year-old and a 4-year-old.
So you know how they get?
Yeah. The eldest was the biggest trouble. He screamed every time he had one.
Wasn't me, was it? No, I've only been here 5 years, so it wouldn't have been me.
And then I bought the middle one for his preschool jabs like 6 months ago, whenever it was.
Yeah.
And he sat and he smiled.
Oh, well, there you go.
I think the nurse was quite amused. Ready? Hold Mummy's hand then. Okay?
Yeah. All right, Mum, you ready?
Let me see it. Good boy. Well done. Good boy.
Is that one?
Well done. You're so brave. Okay, well done. Good boy.
OK.
Well done. I know.
All right. You've got hold. We're going to go Men B now.
Good boy. Well done.
Plaster, plaster, plaster.
Good boy.
Right, turn around, next leg.
Just get it done. Just get it all done. You're fine. You're fine. You're with Mummy.
All right, ready?
Yeah. Good boy. Good boy. Good boy. 1 second and then it'll all be done.
1 more to go. Doing well, doing well.
1 more second, sweetheart. Good boy. Mummy's got you. Good boy. I know.
All done, all done.
That's it. Good boy.
Well done. Well done.
Good boy.
Oh, so sorry.
Good boy. Good boy. He's fine now.
Is he all right?
Yeah, he's such a happy little man. He's a good boy. Aren't you? You might have earned yourself a biscuit when we get home.
Nice.
Have a cup of tea and a biscuit.
Does he drink tea, does he?
Loves it.
Right, so that's everything written up. And I won't see him until he's 3 years and 4 months. Yeah, I'll get the door for you.
Thank you. Come here then, precious.
All right, well,
Good boy. You're going to say ta-ta? Ta-ta.
bye-bye. Take care. Bye.
Thank you.
Come on.
No. Don't do anything.
Hello.
Don't hit on me.
Come on in, have a seat. I'm Dr. Graham.
Please don't do that.
When I was poorly.
Please don't do it. Please don't.
What's the matter, darling? You're not having an injection. See? See? The doctor says you're not going to have an injection, okay?
All right. How can I help?
Injections. Come on, he's got ongoing health issues.
Yeah.
He's on methotrexate.
Yes.
Friday will be week 8 of the methotrexate.
Yeah.
2 weeks ago, some of his blood tests came back with bad kidney function. His creatinine levels were 78.
Yeah.
His baseline is 30. So they took us in for tests. So anyway, for the past 3 days, he hasn't really eaten. He's very tired and he's not himself at all.
Okay.
So I'm quite worried.
And he's on the methotrexate for his skin, is that right?
I know. You're so brave.
36.7, so that's normal. And I'm just going to listen to your heart to count your heartbeats.
Stethoscope. Honey, there's not going to be any injection, okay? You're not going to have an injection. I don't want the blood test. I know you don't. If he needs one of those, can you not tell him?
Kimani is on methotrexate, which is a drug that requires regular monitoring to make sure it doesn't damage your kidneys or your liver. So he has to have regular blood tests for that. He has a number of other medical conditions, which means he has to go to hospital very often to see different consultants. This has made him very scared of going to hospital and why he is particularly scared of needles.
I know you don't like blood tests, my darling, I know. Okay, let's test. Sometimes we just have to test them.
I'm just going to count your heartbeats, that's all, okay?
Listen to your heart. Is it cold? You're so brave. You're brave like a superhero. Yeah.
Okay, that's fine. I think he probably needs to go and get some you-know-whats done. Because of the other issues, because the tablet he's on can bring down his white count, which makes it more difficult for him to fight infection, so we need to know what that is. But the fact that he keeps wanting to go to sleep, you know, and he's not eating, he's not drinking very much, and yeah, exactly, so all signs that things aren't right.
Louis. Please come through.
Hello, hi. Hello.
Hello. What can I do for you today?
Well, it's kind of a follow-up appointment about Louis' heart. He gets a racing heart every now and again. There's no kind of set pattern to it, it just happens. And I was asked to take his pulse when it happened, because we found it was about 80 normally, and it does double. And I've also got another concern. I'm worried about his sleeping. He seems to gasp a lot. Well,
just like that?
Yeah.
Oh, okay.
He stops breathing for a while and then does a huge gasp.
I hold my breath myself.
Yes. You do when you're asleep. I think it worries me more now because I counted how long.
Yeah.
And it was 12 seconds he held his breath one night.
And does he snore a lot at night?
Yes. We call him Darth Vader as well.
That's a pretty good Darth Vader impression. Excellent. All right. And how long have you been worried about his breathing overnight?
Especially worried, probably the last 2 months. He's very fitful in his sleep. He'll toss around and wake up a little bit and go back. And some days he's quite tired.
Bless you.
Yeah.
Do you ever get sleepy at school? No. You don't fall asleep in lessons? No. Or anything along those lines?
I wish.
Oh, really? And have you had any thoughts about what you think might be going on?
Maybe I was worried about sleep apnea. But, I mean, when I was a child, I had a similar thing.
Yeah.
And I think I had an operation when I was little.
So I think that you're probably on the money there, Mum, in terms of what's going on.
Yeah.
I think it's your lymph nodes that you fight infection in your neck. You've also got some in your throat as well.
Yeah.
And sometimes they're a little bit bigger in children than they are in adults. And in general, they get smaller over time.
Right.
As they go into their teenage years. And in terms of operations and things like that, they only really think about those if they're causing a lot of bother.
OK.
Should we have a listen to your chest? Okie dokie. So I'm just going to pop down the top if that's OK, and I want you to take some really big, deep breaths through your mouth if that's OK. Well done. So that sounds nice and normal. So I'll just check your pulse rate. Perfect. Now, how big can you open your mouth and how far can you stick out your tongue? Cool, blimey. So you do have quite big tonsils. So, absolutely happy to refer. In terms of examining him today, he examines completely normally, but I do hear exactly what you're saying about his heart rate being very quick during these episodes. So again, I'm going to sort of make a doctor.
What I'm thinking is if he was an adult, we'd do an ECG here.
Yeah.
And I'm not sure whether we'd do an ECG at his age, just because I'm not sure we'd interpret it.
Well, that's the thing, is the difficulty with interpreting, isn't it?
So I don't know whether... I mean, I'm sure the Children's Hospital offers a means of getting an ECG done.
Yeah, yeah.
And/or whether we make a referral for them to just see him. But it does sound like it's happening at rest, which isn't... You know, we do need to ask the question.
Yeah,
why is
absolutely.
that the case?
All right. So, we will write a letter to the powers that be about you snoring. And we will check in. The best thing to do is check out your heart, OK?
All right, then.
Fantastic.
Thanks very much.
No problem, thank you.
Bye-bye.
Just don't do it. I know you don't like blood tests, my darling, I know.
So is there any way they could do them here? Not have to be at the Children's Hospital.
I don't want to say.
We won't.
I think he needs to go to the hospital. He needs to go to A&E. Because we need to get on with working out what the matter is, OK? I mean, we can do the urine here, but... No, we used to, but we used to have 2 nurses that were paediatric trained, but we don't anymore. So the under 5s, we don't do even routinely. What you can ring whilst you can go home and get the sample done, put it in a pot, yeah. Ring Dr. Mahon and see what he says, and he may say, "I'll see you this afternoon." I don't know, but I'm not sure how much of the problem is to do with a urine infection or not. All right, I'm going to give you a letter, okay? Which nursery are you at?
What nursery do you go to?
I don't know.
Do you like your nursery?
What do you like to play?
Nothing.
Do you like to play superheroes? Not today. Can I be Thor? Oh, do you want to play with me?
I want to go.
We are. I'm just getting this letter.
Okay, but you may need to go
I guess we
to
probably do need
ED.
some more.
Yeah. All right. Do you want me to put that in your bag? Yep. Oh, you poor little thing. Hey.
So can you get to the doctor?
Okay. There you are.
Good boy. Should we go right home?
That sounds like a good idea.
Let's do that.
Okay.
Thank you.
That's okay. Bye-bye.
You okay?
Yes, thank you.
Oh, right. What we have is... I'm assuming it's this foot. I always forget which foot it is. He stubbed his toe.
Yep.
Basically, he has... It's not that one. It's the other. I knew it. 50-50 chance to get it wrong. Right, so he stubbed it about 2 weeks ago. His toe is really quite...
Yeah. It's a little bit sore, isn't it?
It's definitely not sore today, but
Right.
What I don't like is the fact this doesn't seem to be connected to his nail anymore.
How do you mean?
It's all... yeah.
This is all red and pussy, isn't it? That's the bit
This
that
is
bothers me.
It's not right.
How long ago did you say it happened?
About 2 weeks.
2 weeks. I think he probably just needs a very short, sharp course of some antibiotics.
Okay.
Just to settle that down.
Yeah, no worries. That's what I thought. As soon as it started
Yeah.
going red, I was like, it's
Yes.
not there.
Yeah.
I know, sore toe, I know.
So I'm just going to give him the minimum he needs, which is going to be 2.5 mils 4 times a day. So it's a tiny-ish amount that he's going to need. Not stopping you walking.
That's the problem. Nothing really affects him. He just takes stuff in his stride.
Oh, not the bin, though.
No, can you knock the bin, please?
Not the bin.
See, now he's like, I definitely want to get in the bin.
Yeah.
Right.
OK.
Let's say bye, bye, bye.
Bye.
Thank you.
Off we go then.
OK.
Thank you. Take care. Thank
Bye
you.
for now.
There we go, folks.
Thank you.
All right, cheerio.
Bye.
Bye-bye.
Okay, bye-bye.
Thank you very much.
Bye.